Q2 Healthcare Industry Consortium meeting, and I welcome everybody. Thank you for those who were able to make it in person. I know that a lot of people are joining online right now. And before I jump into the agenda and go over all the details, and so you'll see what to expect today, I have my ELT, my executive leadership team here in face of Janet. Thank you so much. You're taking to have a leave today from everybody. If you mind, please giving us some welcoming remarks. Welcome to everybody, and then I'll jump to the agenda.
All right. I hope you can hear me. Don't have a mic. Okay, good. Okay. Welcome, everyone. I just want to start off by thanking Daria. This is not easy to do. It's last minute cancellations. She has to send agenda. She has to keep us all together. And I know she has a team of people she's working with, but I really appreciate her stepping in at a time when this kind of work is really needed. All of us are experiencing a very different time in healthcare. And if there's ever a time where people need to come together and just figure out how we can come up with solutions that really do help meet a lot of gaps that are emerging. So from a cost perspective, a labor perspective, access perspective, what is not being pummeled right now? And it's always nice to be in a room with people, like-minded people who share values, to just encourage one another. I think I have felt very weighted down as I look at, how do we make this work? And so when you're in a room like this, we're reminded that yes, small things, small steps, incremental value, and we do get some wins. So I am looking forward to today. I think we have some great presentations from behavioral health, from the Rural Health Transformation Program, from the LEN EASD behavioral health. And I think it's just another one of those opportunities to hear from people who are really doing the good work, the real work on the ground, and to give us some encouragement and progress. So thank you. Look forward to a great day. Thanks, Daria.
Yeah, thank you, Janet.
Yeah.
Thank you. And those folks who joined us online from the executive leadership team, thank you, everybody, as well. Just wanted to make sure that everybody online can hear us well with the microphone situation. Oh, good, right. And before, yes. We have some new welcomes to do. We have new members who joined us recently. Some folks are online, and we have one in person here with us, Maria. She from the Pathways to Equity Coordinator. She joined us online today. Brian Fix, who is Sky Lakes Medical Center Vice President, who's here with us today. Hi, Brian. And Sheila, CEO of Mercy Flights. She's joining us online today as well. We also have some, we kept suspense still today and wanted to make some internal announcements, and I'll turn it to Julia.
Good morning, everybody. Can you hear me okay?
Yes.
Excellent. I've met most of you, but just a reminder, I'm Julia Pontoni. I'm the director of the Office of Workforce Investments at the Higher Education Coordinating Commission. The Future Ready Oregon team moved into my office when Jennifer Purcell left the agency. And I have some exciting news to share today. The HEC recently hired Robin Sansing. Daria, is she there yet?
Yeah, she's there. Yeah, she's there.
Oh, great. As our Behavioral Health Initiatives Advisor, which is a new role in the agency. In her role, Robin will lead the HEC's behavioral health initiatives, in particular, those that were called out in the Governor's Behavioral Health Talent Council final report. And she'll be working really closely with the governor's office and partner agencies like the Oregon Health Authority to advance the governor's broader behavioral health priorities. Of course, Robin will also work closely with Daria and the consortium to advance your all's behavioral health priorities as well. Robin, I'm sure, can share more with you about her experience, but just briefly, before joining the HEC, she served as the Behavioral Health Initiative Director at Southern Oregon University, where she was leading the development of a regional institute focused on convening stakeholders across behavioral health and early childhood development, mental health, and the wellness sectors in Jackson and Josephine counties. She also served on the Governor's Behavioral Health Talent Council, chairing the subcommittee on education and training. Before moving to Oregon, Robin held multiple positions at the University of North Carolina and UNC hospitals, both clinical and non-clinical. So we're really excited to welcome Robin and have her as part of the HEC team and working with the consortia really closely on behavioral health priorities.
Thanks, Julia. Yes, welcome. All right, and you'll get to be broken into small group discussions later today, and Robin will be leading one of them as well. So next, let's go over the agenda. So we will have a HEC legislative update, then we will move into the Rural Health Transformation Program, the state focus on behavioral health from our partners at OHA. We will hear a report on Behavioral Health Talent Council, and then we will have a short break. And right after that, I will set us up for strategic work plan discussion. We will break into small groups and we'll come back to report out. Then we'll grab lunch and move into listening to the presentation and the student panel from our hosts today, amazing hosts today, Lainey SD. And by 1:30, we will be done and you will be back on the road home or back to the office. So with that, let's get some housekeeping going first. So consent agenda. In your folders right now, and those folks online, I hope you had a chance to review minutes from January 22. We sent all the materials ahead of time as well. So I'd love to have a motion to approve.
So moved.
Thank you. Do I have any seconds?
I second.
Thank you. Do we have any discussion or objections? All right, hearing none, approved. Thank you very much. And public comment. Do we have any public comment at the moment?
We have no public comment at this time, although I will direct members' attention to two pieces of public testimony submitted by Carlos Cortella that is available on the website. One is written and one is video.
Yes, one is video, and we highly encourage you to take a moment to review and provide your feedback. Very interesting material there. And also to remind folks online that we really, really value and appreciate any public comment. So please do register, please do submit your testimonies. We do take pay attention to them and to take them seriously, take them back and work on them as well. And if you have experienced any issues, please reach out and let us know. Those are easily fixed issues. Right. So then is Kyle with us? Yeah. Okay. Well. We are waiting a little bit for Kyle. Like this. Just a few moments. That will give you a chance to review what's in your folders right now. The biggest chunk of today's work will be at 11 o'clock. Starting at 11, we'll have the strategic work plan discussion guide. So if you have right now those couple minutes, I would highly encourage you to review, to start at least paying attention to that, because you'll have a few minutes only to review it and then jump into discussion groups. On the other note, he is here, so we'll do that later. Let's jump ahead. Kyle, thank you. We're ready for you.
Yeah, sorry, I showed up right at 9:15. Yeah, good morning, folks. Kyle Thomas, Director of Legislative and Policy Affairs for HEC. Just provide you a couple quick updates regarding legislative developments, process and planning for 2027, which is where I'll start. So here in April 2026, we are at HEC in the process of developing legislative concepts and policy option packages for the 2027 legislative session that will run from January to end of June, early July of next year. We have just in the last sort of month, 6 weeks, received formal instructions from the governor's office and the Department of Administrative Services about what that process looks like for executive branch agencies. I'm sure most people here are at least relatively familiar with the budgetary situation of the state. And so I don't think that it is a surprise for me to say that there are some real constraints on that exercise. Namely, the constraint that we at HEC are operating under is that we are not able to request any new money for new initiatives unless that funding request is offset by spending reductions within our own budget. So for HEC, an agency that essentially sends over 95% of its funds out as pass through to either students or institutions, it makes it really hard to suggest any new initiatives as we're sort of not really in the position to suggest reductions to institutional pass-through funding that we fund through our formulas or student financial aid funding. And so we're really doing this exercise with a net zero, really no new funding increases that we're proposing at all. There are some things that are accepted. Those are really technical things, phase 2 of IT implementation, other sort of minor exceptions that I won't necessarily get into. But that's creating a difficult environment for budget and policy development. That's not to say we don't have legislative concepts that we're considering, but in the confines of no new funds, those concepts are a little bit more limited than perhaps we would have proposed in the past. We are proposing there's really nothing specific to your issue area or really nothing significant in workforce in general that we are proposing. Probably the most relevant concept is we're proposing to make some adjustments to financial aid um, in the next session. Particularly, we're looking at our state need-based grant and how that serves as a retention initiative for students, and potentially looking at the possibility of gaining the statutory ability to withhold a very, very, very small amount of funds that we would otherwise allocate to new students, so that we could retain those funds to allocate to students that are experiencing some emergency needs. Think the flat tires and the unexpected medical bills of the world that affect students that don't have emergency savings accounts or who are already expending all of their financial aid to support their living expenses above and beyond the tuition and fees they pay to attend. So we're excited about that, but I say that to you only to sort of suggest that that's sort of the most significant, probably, legislative concept that we're set to or proposing the governor introduce in the 2027 legislative session. That is not to say that there aren't other areas where workforce issues are being considered. They certainly are. We're aware of the work of the Prosperity Council and the fact that they are likely to propose some higher education and workforce training recommendations from that council. I do not know what they are yet. But we expect that those recommendations will be available sort of in the very, very near future as the council prepares to wrap up its work. We're also sort of having discussions about how to tie the state's emergency economic development plan to higher education in better ways than we perhaps have had in the past. But again, I don't really have specific news on those issues to share with you at this time. The other sort of main area where we're looking at workforce and economic development and higher education and tying them together is related to the House Bill 4124 work that we've been asked to do by the legislature. I don't know that folks will have familiarity with this, so very quickly, the legislature in this session has directed HEC and provided HEC $1.5 million to look at issues of the sustainability of the entire system of higher education in light of projected deterioration in institutional finances, and make several recommendations to the legislature regarding the missions of institutions, issues of academic and financial administrative coordination between and amongst them. And in doing so, to consider the economic development and workforce needs of the state. So that is likely to be a significant component of this work. And we're in the very, very early stages of starting to accomplish that. Namely, we've hired a consultant, Oregon Consensus, a group out of Portland State University, to go and talk to every possible partner who has an interest in this work and ask them for their perspectives about how this work should be conducted and how they see themselves involved in it. That's going to feed into an RFP process where we will actually go out and hire the technical consultant that will help us do this really quite massive project that will look at everything from collaboration amongst institutions all the way up to various and potentially even quite significant integrations between institutions, all with an eye towards retaining access on a statewide basis and on a regional basis to the specific services that are required to keep this state competitive and for students to be able to access a comprehensive higher education. So that's essentially the commission's main legislative focus over the course of the next year. The report is due in April 2027. And it's potentially one of the most significant, I don't think it's an exaggeration to say it's one of the most significant, if not the most significant body of work that the commission has been asked to undertake, certainly in the 10 years that I've been here, and perhaps one of the most significant in the history of the commission, which is about 15 years now. I've also been asked to sort of give an update on the issue of the professional designation related to graduate student loans. I don't know that I have very much news since maybe the last round of legislative updates I provided to the subcommittees, although I don't know that I spoke to you necessarily in the last cycle. There is recent reporting it was in the Inside Higher Ed just 2 days ago that unfortunately suggests that the state of Oregon is likely to be one of the most impacted states related to the professional designation issue for access to graduate student loans. And that analysis that was published shows that approximately 42%, up to 42% of Oregon graduate students could be affected by these caps. And so the question really immediately becomes, what are we going to do about it? And that's a question we don't have really good answers to. And I think the primary reason we don't have a good answer to that question is that unlike other states, Oregon currently lacks a quasi-public entity that other states have that has been previously endowed to provide loans to students. And so in states that already have that infrastructure, you have seen them make moves to change their lending policies and provide incremental funding to those programs so that they're now able to help students cover the gap. Unfortunately, we don't have that process or that structure, and establishing that structure is an expensive endeavor to provide that entity with the corpus from which it can start to make loans. There is a group looking at this issue. They've met a couple of times. It's primarily comprised of representatives of the private degree granting nonprofit institutions in this state and the public, a couple of the public universities. I'm sitting in on that group as well. There's not any defined work product yet. The last that group was going to do was to try and conduct an analysis really designed, I think, to shrink the ask to something manageable, perhaps in this budgetary environment. Really looking at where are the, similar to the analysis I talked about with the 42% of students affected, where are the specific degree programs that are likely to be most affected, balanced against which degree programs lead most directly into career areas where Oregon is sort of experiencing the most pressing workforce demand. That's not to say that should be the policy of the state long term, but it is an exercise in trying to figure out how to potentially get something started in a time when we don't really actually have all that many resources to get something started. There's no, like I said, that question has not been answered. Hopefully, I'll hear back from some members of that group soon if that's an idea that they wish to continue to pursue. I think that's probably all I have for you today. I wish I had more. I wish I could tell you about all the POPs policy option packages we were putting together for workforce development, but I'm happy to answer any questions that you might have.
Yes, thank you, Kyle. Do we have any questions maybe in the room or online?
Kyle, can I ask a quick question?
Absolutely.
And you may not know the answer to this, but was the direction for offsets for all agencies or just for HEC for new
So,
pops?
Yeah, that generally applies to basically every agency. Certainly, like any budget cycle, good or bad, the governor will have her priorities, and you will see her priorities get accepted from those directions, but those will be very specific and limited instances relative to the total volume of the state budget.
Thank you.
I had a question. Thank you so much for that really helpful update. I was curious, you mentioned the 42% of Oregon students are going to be impacted by the professional designation. Do you have a sense of how, I would imagine probably a large percentage of that is healthcare related degrees? Was any sort of breakdown provided? Or do you have a sense?
That breakdown was not in the reporting. It may be in the underlying analysis. And I'm right after I get off this call, I'll see if I can find it and I'll send it to someone from HEC who's in the room who can share it with you.
Kyle, can you just tell us again, what was the title of that? It's in the Chronicle, right, the article?
It was in Inside Higher Ed.
Inside Higher Ed, okay.
Yep, and I can, if you give me just a second, I can, oh, it's been shared.
Yeah. Thank you.
We have some more time to ask, or unless we have any more questions.
I'll just make one final
Please do,
comment
yes.
on the professional education. I mean, I imagine it's probably gonna impact healthcare careers pretty significantly. And you know, those careers that provide direct patient care. And you know, through Oregon Health Authority in partnership with the Office of Rural Health, we have a fairly significant loan repayment program that's state funded. And so, you know, there are definitely going to be equity impacts to who's going to choose to enter these careers.
Isn't that, I think it's listed in the federal guidance, like which professions, it does impact quite a bit of behavioral health master's level.
Yeah.
Pieces of proposed. So I think if you just even Google, I know somebody put a link, but you can get directly to that federal guidance on graduate degrees that have been designated as non-eligible. How's it? It's a new link.
All right, well, I think if we don't have any more, we certainly have time. So I do encourage more questions, but if we don't.
As I depart, I've put in a memo written by the Institute for College Access and Success that does an analysis of this. Specifically, I think it does include a racial equity analysis, so that might be interesting reading for the individual who made the last comment and others.
I'll identify myself just for the record. Neelam Gupta. I'm the Oregon Health Authority in clinical supports integration with workforce.
All right, hearing no more questions or comments. Yes, thank you, Kyle.
Yeah, have a great day.
Thank you. All right, well, we have a little bit time left, and I'm actually very excited that we do have this time right now because, again, I'm turning you back into the strategic plan. Since everything is back to back and we do have upcoming reports, and then we won't have much time to review the strategic plan. We did send everything ahead of time, but I also know how busy, what busy schedules you all have. So let's use this. We have 10 minutes right now. So let's use this time to review that strategic plan that is in your folder. And also along with that, which will save you time, and you can actually really have a grounded discussion in your small group discussions. Take a look at the questions that are in the guide along with the strategic plan so that you can jump into that right away before I break you at 11. Okay, so let's spend 10 minutes on that right now. our next presenter, and it is right on time, perfect 9. So let's see, we have Rural Health Transformation Program, stay focused on behavioral health. And Yudi, are you with us?
Yes, I am. Hi, everyone.
You're welcome.
Can you hear me?
Yes.
Yes.
Great. And thank you so much for inviting me to present on the Rural Health Transformation Program. For many of you I have not met, my name is Yudi, and I am at the Oregon Health Authority, more specifically the Office of Health Policy, and I'm Chief of Staff for the Rural Health Transformation Program. I'm here today to provide a quick overview of the RHTP and also relay some exciting developments as it concerns behavioral health and workforce. I believe that was a request made from this group here to learn more on that front. So if we can go to the next slide. This is just a disclaimer that the presentation and program at large is supported by the Centers for Medicare and Medicaid Services. Content presented in this capacity and in this space may not necessarily represent the official views of the federal government. Next slide. And if you would like this presentation in another language, large print, or other alternative formats, please just let us know and feel free to reach out at this email here. Next slide. Okay. I did voice over the agenda, so we'll walk through the background to the program, discuss how this looks in the state of Oregon, and review the work to date and timeline for the next few months, and then open it up for Q&A. Next slide. Next slide. Okay, perfect. So here's a background of the Rural Health Transformation Program. This was part of HR 1 passed last year in July. This reconciliation bill, also known as One Big Beautiful Bill, introduced numerous cuts to federal programs, including to coverage, food benefits, and other funding sources. And with RHTP, the money that's coming in is not intended to offset HR 1 Medicaid cuts. This program is a time-limited 5-year program focused on supporting rural communities. And something else to note is that funding, I already touched on this. Funding is designed to support transformation, meaning new or expanded projects, so it can't go again to supplant or duplicate existing efforts. Next slide. Here's a list of the statutorily required use of funds that RHTP funding must go towards. Oregon has 5 initiatives that covers all 11 CMS approved use of funds. This way, we're supporting maximum scope and flexibility for state organizations. When it comes to the Catalyst Awards, which I'll go over shortly, they may apply across any of these 11 use of funds. And again, it just allows us to really maximize the utility of the funding coming down. Okay, here's the federal update. On December 29th of this past year, CMS announced that all 50 states have received awards. Oregon is receiving approximately $197 million in the first year of this program. This program is administered through a cooperative agreement with CMS, which means that there will be a higher level of involvement, including on reporting and oversight, compared to a typical grant program. You may have heard that some of the funding was initially restricted. Over the past several months, OHA has worked with CMS to provide additional details, and those funds have now been released. So that's an exciting milestone in the course of this program. We learned about that on May 19th, so have been diligently working to ensure that funds can be drawn down since. While all of that is exciting, it also means that there are still important requirements and expectations tied to how these funds are used. Next slide. One more. Okay. So how does this apply to the state of Oregon and how we've framed and structured RHTP? So Oregon initially proposed 5 initiatives, and all 5 of those initiatives were approved in our updated budget. The font is a bit small here, so I will read the initiatives out loud. Starting from the left, we have regional partnerships and system transformation. Second, we have healthy communities and prevention. Third, we have workforce capacity and resilience. Fourth, we have technology and data modernization. And then lastly, in honoring our government to government relationship, the 9 federally recognized tribes of Oregon have received funding under the tribal initiative as an 11% set aside. So I can go into detail about the example use of funds, but given the timing, we can circle back to the slide if folks have questions. These are just example activities that fall under each of the 4 initiatives plus the tribal initiative. If you want more detail about what's encompassed, you can also find that on our webpage, which I can link after we get to Q&A. So how is Oregon defining rural? We are using the definition of rural used by the Office of Rural Health, and that is defined as areas greater than 10 miles away from a population center of 40,000 or more people. And all funds will be directed towards rural and remote areas. There are specific exemptions for when an urban-based organization is utilizing funds to expand or create new activities in a rural or remote area. For instance, medical residency programs and their rotations. It might be an urban academic center that partners with healthcare providers in rural or remote settings, and that would be potentially eligible for funding. Next slide. Oh, thank you. So this is how we have staged the Rural Health Transformation Program when we think about the 5 years that we have to scale up implementation and to take initial year learnings and apply that to future year in order to really achieve the blue sky vision of a resilient rural healthcare system, right? And getting there will take a lot of effort and also time focused on regional planning and innovation. That icon at the bottom left is really going to be led by the Office of Rural Health. This is a way to get entities involved with regional conversations, receive technical assistance on specific healthcare issues and categories, whether that's IT or maternal care. They will self-identify those areas of focus. Also in phase 1, we have the Catalyst Awards, which many of you might have heard of. This is currently live as a request for grant proposal. So this is our way to allow for organizations to apply for RHTP funding on ready-to-go projects that hit on one of the 4 initiatives that I just spoke about. And then also we have immediate impact awards. These immediate impact awards are intended to directly grant funding to identified organizations who will help us achieve the federal targets that we've laid out in our application. So it really does ensure administrative success so that we can get renewed funding for subsequent years. And all of this under phase 1 is focused on activating with this novel program, stabilizing critical services, and being planful for the next 4 years of the program, excuse me. So phase 2 would focus on federal fiscal year 2028 through 2030. And we are intending or envisioning that there will be a competitive solicitation process once again to be selecting for more planful, collaborative concepts intended to transform the system. And the reason why we have regional planning and innovation in phase 1 is to encourage organizations to start participating and integrating those learnings and apply collectively for phase 2. Next slide. Okay, so I did mention that we have right now the Catalyst Awards RFGP live. This is the list of eligible organization types that can apply for Catalyst Awards. I will note that it is organization types eligible, but not limited to. So you can see we've really tried to cover a full spectrum of who we consider to be critical partners in this healthcare ecosystem. And it's not just your traditional direct providers, but also all of the other different layers of local and regional networks that are critical, again, to the end-to-end delivery of healthcare and workforce. So interested applicants can now access that full solicitation on organ buys, and feel free to refer to our website. It will walk you through the steps and how to access organ buys. We also did have a webinar focused on the Catalyst Awards last week. Those webinar slides and recording have been made public as well on our website. Next slide. And here's just a summary of what types of projects we're looking for and what that eligibility is. So at the project level, there are a few key requirements to keep in mind. These projects must serve rural Oregon, and they must align with at least one RHTP outcome. So these outcomes are assigned to each of the initiatives that we went over a few slides back. And we are asking that also projects address at least one population of focus. Projects that are ready to go should be, by definition, ready for implementation within a relatively short time frame following the award. And I will just say again that these specific details are included in the RFGP in organ buys, and feel free to refer to our website if you have any additional questions there too. And one more slide. Okay, here is the timeline of phase 1 and 2, somewhat truncated on the right-hand side, but this was a fast and furious application process, and honestly, implementation process too. CMS released its applications to all states last fall, and we had really only a 6-week window to pull together an application and budget and to submit that. In turn, CMS made its decisions late last year, and we finally were able to unrestrict our budget in March. So looking ahead, we have phase 1, again, that's the Catalyst Awards, the Immediate Impact Awards, and Regional Planning and Innovation. That is all to stabilize, activate, and plan for phase 2. And phase 2 will focus on the last 3 years of the program, when we really hone in on the successful pilots and efforts from phase 1 and think about regionally driven strategies to sustain transformation in rural areas. And then looking ahead, this is where I'll touch on the behavioral health connection. So our first immediate impact awards, that announcement went out on April 10th. In the slides, there's a link to the press release. Numerous projects support behavioral health, including SUD and OUD services, and others are aligned with the Behavioral Health Talent Council recommendation. I know that I've worked with some HEC members as part of the Behavioral Health Talent Council, and the final report that went out back in, I think, January of this year. So feel free to refer to that press release to get a peek at the current wave of immediate impact awards that have been announced. We are anticipating more immediate impact awards being finalized and announced in the forthcoming weeks. Catalyst awards are open, and those close on May 26th, the day after Memorial Day. And we anticipate using the weeks that follow to make award decisions and announce them by mid-2026. This is really critical because the states have a truncated timeline to obligate funding per CMS terms and conditions. And so really a lot of legwork does have to happen in the first half of this year for that $197.3 million that was awarded for just budget period 1. And then CMS each year will redetermine how much funding the state gets. And if we sustain around that ballpark number of 197, we could see upwards of 1 billion for the next 5 years. And then Office of Rural Health, they will be conducting regional convenings per the regional planning and innovation part of phase 1. This is again to gather healthcare providers and partners in self-defined regions to talk through what are the critical needs of that area and how might RHTP play out in that space. And then Office of Rural Health will also be coordinating ongoing technical assistance, as well as be planning a vendor roadshow for October. Next slide. And QR codes for our website and to sign up for our bi-monthly newsletter. All updates will be shared through the website and newsletter. And because all public-facing materials require CMS approval, sometimes there might be delays and updates may not be as immediate, but we are doing our best here to stay engaged with the community and to communicate consistently and regularly. All right, I think that wraps up my presentation here, and I went a little bit over, but I can stay on a few minutes for questions if there are any.
What's the vendor roadshow gonna look like?
Yeah, so this will be likely, the planning is ongoing, an additional day tagged on to the Office of Rural Health's annual Rural Health convening in Bend. And part of the vision behind the vendor roadshow is to invite technology vendors to the space to showcase their health information technology or product so that current grant recipients or future grant recipients who apply in phase 2 have a sense of like the breadth of technologies they could include in their budgets. Because CMS under RHTP has a huge focus on integrating technology, whether it be remote patient monitoring or e-consultations between providers, all of that, require actual IT products. And so having a vendor roadshow for vendors to come and showcase that was the intent behind making this as comprehensive and as independent from the state as possible.
This is Heather Jeffress from Oregon Council, Yudi, thank you.
Mhm.
I had a question on auditing and compliances. You mentioned that CMS has to improve communication, so I was wondering if there's if there's a outline or expectations on auditing and compliances for grantees with this particular funding.
Yeah, as with any other federal program, the agency has reserved rights to audit subrecipients. So subrecipients would be the organization that is granted funding from OHA. OHA is considered the main recipient. There are financial reporting requirements baked into this program, as well as program quantitative reporting requirements, depending on the initiative and target. I will say OHA is doing its best to try to roll up information in our federal reporting so that it doesn't expose organizations to unnecessary admin burden, as well as we're not requiring patient level data. It may ask for how many patients were served by the clinic on this particular program, but nothing that would release PHI to that degree. So it is top of mind to make sure that we are in compliance, but also not passing down or imposing additional burdens where they do not need to be.
Thank you.
Mhm.
Right, hearing no more questions. Thank you, Leo, for joining us and giving the presentation. And I know that you've extended welcome and for folks to reach out to if they have any more questions. So we'll let you know. Thank you.
Yeah, and I'm dropping the website in the chat, and that will give you the link to, oh, that's the press release. Sorry. So that's the press release on Immediate Impact Awards. And then that's the website where you can find information about the Catalyst Awards. Okay, thank you all.
Thank you. Thank you. All right, thank you, Leo. And now we're jumping to the next presentation on Behavioral Health Talent Council final report. We'll have Alice joining us virtually and Robin here with us in person.
All right, Janet, I'm gonna apologize now, because it seems like the camera.
Oh, no,
is
I can
facing
move this
that
way,
way.
you're good.
Okay.
You're
so it's like,
good,
so all you get is my
you're
back.
good,
I
you're
feel
good.
terrible.
No, you are good.
And is there any way to have Alice pop up as well, so she and I can at least like pretend eye contact? Eye contact.
Yeah.
There you are.
Hi, good morning.
Hey. Hello in the room, people. I am your person. Online people, Alice is your person.
I'm your person. Hello. Well, I am going to kick off our presentation, and I first want to thank Daria and say what an honor it is to present to you today. I am Alice Gates, she, her pronouns, and I currently am faculty with the Public Health Practice Program at the OHSU PSU School of Public Health, where I also direct our rural workforce development work, which is funded by 30-30-30, and very aligned with a lot of the work of the Behavioral Health Talent Council. I'm going to let Robin introduce herself when we get to the next slide and when she first talks, but a lot of my work and contributions and participation in the Behavioral Health Talent Council, and specifically in the Education and Training Subcommittee, was informed by my work teaching for 14 years in Oregon in an undergraduate social work program at the University of Portland. And in those 14 years, what I observed was both a sort of growing set of gaps and also a profound mismatch between the education and preparation that students, and this is just one part of education and training. I realize undergraduate students are, a small subset of who we're talking about, but a mismatch between the preparation they were getting and then the workforce needs in the current moment. And so this is also, we also are observing a lot of systems level failures and problems. And so I come to you today with Robin with a lot of humility and also gratitude for the work that came before, a lot of work by legislators, by policy leaders, by healthcare industry leaders like yourselves have gone into chipping away at this very entrenched and long-term problem. I will say that what we're doing today is a high-level overview of some highlights of the education and training subcommittee recommendations. And so some of what we're doing, I would encourage you to read the full report, which I have here as my prop, which you can't see because of Zoom. This is a comprehensive set of recommendations. What we're going to do today is share some of the more promising and exciting pieces. And as any good educator, I'm going to ask you to start now thinking about, as you hear the bits and pieces we'll share, what is coming up for you? What is most resonant? What are the priorities? I also just want to thank Robin for joining me. When Daria first asked me to present to you, I said yes. And then within a few weeks, I learned that Robin, who had chaired our subcommittee and done an amazing job, had been hired by the HAC in this new role. I'll let her tell you about it. But I said, Robin, do you want to do this with me? And she agreed. So thank you, Robin. I think we're ready for the next slide.
Thanks for the kickoff, Alice. I appreciate it. I now feel like we're grounded, being back in the classroom. Everyone's got their thinking caps on as we talk, so it won't just be me informing you. But please know you can stop Alice and I at any point if anything comes up that you have questions about. We are super flexible. I think Alice mentioned something really important, and that is that we're speaking to you on behalf of the Education and Training Subcommittee. So there's a ton of things that we will not be able to address. And I apologize for that, but please know if you have any questions about the other stuff that the other subcommittees did, we can get you in touch with people. We know people. So feel free to make a note and I can try to make some connections if other things come up that we can't answer today. Just a quick introduction because you all heard about me from Julia this morning. I'm really honored to be in a new role at the HEC, and I come from a career in behavioral health. So I started out doing case management in the mountains of North Carolina in a very rural community. And I was serving families with kids with pretty big needs. And we would drive an hour and a half to try to get help for these kiddos. So it was a resource desert, similar to what we experience in lots of parts of Oregon. And so that's my background in history. And actually, I had kids with pretty high needs. So we needed to move to the city and we went to Raleigh, and I was at the University of North Carolina in Chapel Hill for many years, where I got my degree as a parent and an older adult, because I knew that I needed to be part of trying to help make things better. So since then, I've been lucky enough as a licensed clinical social worker to work in the hospital system. I have talked and I've partnered with community organizations to help students be in the community to learn and practice and grow. And I also have a small private practice. So I feel like I can speak to all the things, and am grateful for that experience and how that lends itself so well to what we were able to work on with the Behavioral Health Talent Council, which is just one step of this, right? So I bring all of that into the work with the HEC, but it comes out of where we started. And I don't need to tell you all that when I say that we are in a behavioral health workforce crisis, this is not new. We are not just all of a sudden like, how did we end up here, right? This conversation has been going on for more than 5 years. So before we even got to the Behavioral Talent Council, there were consortiums coming together to talk about things. The HEC put together an amazing report about, it was 2 or 3 years ago from AHRP. Do y'all remember? Yeah, and Heather was on that group, and I was part of it as well, where we looked at the workforce and all of the data to tell us what was happening. From that amazing report, there were, I want to say, like 78 recommendations about how we could fix behavioral health in Oregon. Does that sound right, Heather?
Yeah, it was very comprehensive.
Yes.
As well.
It was huge. It was huge, yeah. And so what happened is the governor looked at that and said, well, this sounds great, but it's so massive. How do we actually operationalize any of that? So out of that work came the Behavioral Health Talent Council. And what we did in that space is we took that giant report And we split it up to try to make sense of how do we actually do these things that would make a difference for our community. And so we knew we needed to bring everybody to the table. And so we had people from healthcare, from education, from nonprofits, for-profits, everybody that was involved in the behavioral health system, including practitioners and people that had once been clients in the systems and were now out there doing the work. All of these folks came together and we got split up into 3 subcommittees, which I think was brilliant because when we took that massive report, it was just, you know, it was this jumble of different things. And so the 3 subcommittees were recruitment and retention, licensure and training, and then licensure and licensure and certification, thank you, and then education and training. So as I mentioned, I can't speak to many of the things that came out of the other 2 subcommittees, but Alice and I were both part of education and training. And what we were able to do in each of those committees was to break down those big ideas into manageable pieces. So we looked at workforce shortages, recruitment and retention, and the strain on keeping people into the system, not just keeping them, but also helping people find their way to the system to be able to join the workforce. And we talked a lot about burnout and turnover, because that is kind of the cycle of things, right? That we just haven't been able to kick. So as the whole group pulled in all of these different pieces, for education and training, what we knew we need to focus on were these 4 pieces around growing the workforce, clarifying pathways, expanding access, so that people are able to actually get the supports they need, and then match training to need, which Alice just spoke to so eloquently, right? That what we know is that a lot of the training that's happening, especially in higher ed, isn't necessarily matching with what the community needs are. And how do we start to talk about that? So that was what we did. We took that huge jumble of stuff, just sort of threw at you, and we're able to pull it down into 8 different areas. And so, Ronan, these are the 8 areas that we identified were things that needed to be focused on. Developing clear pathways, increase licensure transparency, improve career awareness, expand cultural responsive and rural frontier strategies, strengthen partnerships, strengthen community college pathways, expand degree pathways and completion, and expand exploration and development. So none of this should be new for y'all. I mean, I think we are hearing these things in lots of spaces, including the rural transformation work that we heard about just before this, right? Like we are all seeing these different issues pop up. And that's what showed up in our examinations as well. What we did is this was too much, right? We split it all up, we looked at these different areas, and out of this, we then generated kind of these different pieces that we were going to focus on that stood out. And I'm going to let Alice take us into that next
Great.
piece.
Excellent. So Robin's being modest. We developed 35 unique strategies under those 8 action plans, which if you've worked with a group, you know that requires a massive effort, but it was really worthwhile. So today, Robin and I went back and forth a few times about sort of lifting specific strategies, but we decided instead to focus again on sort of what's the story here? What is exciting, promising, and we think impactful? So we're going to focus, I'm going to talk first about developing clear pathways and just some of the examples and ideas that our subcommittee and the council is recommending. Robin will talk about the Behavioral Health Resource Hub, and then we'll both talk about the importance of partnerships. Next slide, please. So I was thinking again about sort of my history of working with students, and 2 things came up for me that will lead me into sort of sharing what we came up with. One is just the tremendous frustration that I experienced and that students experienced when, for example, they're transferring from a community college into a 4-year program, only to find out, after having been advised well in their community college and having been advised by admissions counselors, that actually things are not going to transfer easily, that it might add a semester or a year onto their educational pathway. And so that's just one example that we know is fairly common. And so we really wanted to avoid that situation. Because the other side of it is, as an educator, and as somebody who cares about behavioral health broadly defined in our communities, one of the most exciting things is when you start to see in that learner, student, somebody who's doing a career change, this, they start imagining their future self, and they can sort of start to see themselves into a career pathway. And when that coalesces, it is one of the most exciting things. So that's our vision, is to make that happen more frequently and easily for students. So some of the specific ways we identified, again, this is informed by members of our committee, subject matter experts, folks with lived and living experience, is creating better articulation between programs. And that involves credit transfer maps. And some of what we're talking about exists in kind of one-off ways, but what we really want is to sort of standardize some of this so that it's actually really easy and also expected that institutions are unifying around these goals. So we heard from one community college who said, I really can't get it. I can't work with this organization. I can't figure this out. We also talked a lot about the importance of creating more entry points and more inclusive entry points. So thinking about, again, the role of peers and peer support specialists and family support specialists, and making sure that those pathways in terms of training and credentialing are clear. That definitely overlaps with licensure and other subcommittees. And then the last thing I'll say is just the role of introducing behavioral health careers early and often. So there are recommendations about creating high school curriculum, piloting this in urban and rural settings, expanding dual enrollment, dual credit sorts of pathways, and again, figuring out ways to centralize, standardize, just create an expectation that in Oregon, we're going to make this easy for you if you have this inclination. I'll just add one quick anecdote. One of the most impactful speakers we heard from, that it really sort of transformed my thinking, was a high school student who'd been trained to work for Lines for Life. And she was able to talk about not only what she was doing currently as, a 16-year-old working in the behavioral health ecosystem, but also all of the transferable skills that would serve her in, multiple careers. So I was so jazzed to hear from her, and it really affirmed for me the importance of starting early and not being afraid to introduce those pathways. So that's one set of highlights, and I think we're ready for the next slide.
Thank you. We talked about that there were those 8 areas that we identified, and in those, as Alice said, there were 35 recommendations. Of those 8 areas, at least 5 of them had something about needing a more accessible and prominent resource hub. And so that is a huge piece that we want to lift up, is developing a behavioral health resource hub that will serve lots of different folks. So that means it's people that are looking, as students that want to figure out, okay, I'm interested in helping people, but what is the right path for me? How many people got into your careers just knowing that you wanted to help people? Right. Seems like everybody, like all the students that come into that I've worked with are like, I want to help people, but I don't really know how to do that. So making sure there's a place they can go to figure out what is their path to help people, what's the right fit for them. Making sure that as employers, we can get out there. These are the kinds of jobs that you can expect to look for. This is what the work is going to look like. This is how you know what you're signing up for, so that you don't end up in a work position where you're just like, but this wasn't what I wanted, which can happen more easily than sometimes we like to think. It's a place for agencies to come, especially like state agencies with policies and also licensure information to say, this is what you need to be thinking about. These are resources for you when you go down this path, so we can help get you licensed. We can help get you set for what's going to be next for you. So being able to pull all that together is critical. It's also a place where we would want to invite our educational system. So can we get our high schools in there to talk about their programs? Can we get our community colleges and our four-year institutions to say, look at all the opportunities that are available for you, because sometimes students don't even know what is just available down the road, you know? And then I think the other piece about this that is so important is that we're really thinking about how we're bringing people together to share this information and make it accessible. So, you know, I have loved being in Southern Oregon. I was surrounded by just amazing institutions, Southern Oregon University and Rogue Community College. And in my role there, I would often see some of the students coming from Rogue Community College in their behavioral health program. They were coming into SOU because they wanted that four-year degree, but they weren't sure, should I do psychology or behavioral health? And, you know, even those questions, and these were programs with strong advisors, right? Rogue Community College is on fire. They're getting their students through the program onto what's next. And SOU's got these great programs, and somehow those students are still wondering, wait, what's the right pathway for me? So again, if we can pull these resources together so they know where to look, it's not just like, do I find the right person that can help me with this, but how do I go and figure out what I need? The Behavioral Health Resource Hub will get us there. So I really think of it as like sort of this thing across the bottom where it says a single place where people can see how to enter, advance, and stay in the behavioral health system. That is our goal, right? We want to keep people not just like showing up and sort of finding their way there, but to actually land someplace that has meaning for them, know that they can grow in their skill set and the work that they're doing, and find real satisfaction in that, and not end up burning out and going and doing something different. So that's what we're going for with that one. Alice, you ready for the next?
Yep, ready. So the last thing we wanted to lift up was the importance of partnerships, and we felt like it was very appropriate given the role of consortia. But I'm Robin probably when she saw this slide is like, what are you thinking with this? But I wanted to also just celebrate that that we were able to pass legislation from the work of the Behavioral Health Talent Council in 2025, largely because we brought together, as Robin said, all of the players and especially employers. So House Bill 4083, which is about reducing red tape. That's what the image is there, if you were lost.
Now I get it.
See, I know, wait for it. So this bill was really about addressing, you know, what are the administrative burdens that, you know, either, you know, make it hard for people, make people reluctant to go into this field, contribute to burnout, create barriers for people to get licensed. And again, like what we know about workforce development is people need ladders. They need little steps that they can take. And so licensure is not pro forma. It's really a key piece of things. So, but I'm highlighting this on the partnership page again, because we needed everybody in the room to really understand not only what's the problem, what are the, you know, hearing from directors of community mental health agencies from around the state, and hearing from people who are professionals and saying like, you know, I have to file these 3 almost identical reports and I'm not even paid for the time that it takes me to do documentation, you know, so there's a lot more work we can do, but I did want to sort of celebrate this early success and say, I think it's totally because of the partnerships that the council facilitated and sort of required. So, and I think Robin's going to say a little bit more on the next slide about partnerships.
Do we have another partnership slide?
Well, we do.
Okay.
Yeah, surprise.
Good to know. Okay.
Yeah.
So I think the point that I wanted to bring in around partnerships is that piece that Alice just touched on, which is we needed everybody at the table. So one example of this, one of the things I'm really proud of that I was able to do in my time at Southern Oregon University was start a behavioral health workforce consortium. We hadn't had that in the area, and in a very short time, we brought at least 50 organizations together to start talking about what are the needs of the community, how do we help make those things fit with what's happening in the education system. And I remember going to visit our CCO and having them say, you know, the skills that the students are coming out with are just not what we need, you know, and then being able to then go to the Health and Human Services and them saying, you know, it'd be great if we could get some more, you know, high risk skills on board with our students, and then being able to take that, for me to be able to take that back to our clinical mental health counseling program and say, hey, we're getting this feedback, and then brainstorming about bringing back an advisory board, which they had in the past and we're thinking about bringing back in, was just so satisfying for me to be able to see how if we can build these bridges, we can actually make some changes in that space. And so it just brought home to me how important these partnerships are. And it's really easy to look across the room and be like, oh yeah, we need to be having conversations. But then we get so busy that we're not. And so that's one of the things I so appreciate about the work that you all are doing and the work that Daria is doing to bring the consortium together, because everybody in this space, whether you're in person or online, your voices are incredibly important for us to make changes in this space. I mean, that's just how it's going to be. So I really think that a big part of what the Behavioral Health Talent Council was trying to lift up was figuring out how do we bring people together, how to create existing networks like this one, so that we're not, first of all, reinventing the wheel, but also that we're working in partnership together to move things forward and make the changes that need to happen. And so, again, this is one of those things that you'll find throughout the Behavioral Talent Council report is we need more partnerships and we need to figure out how to be in conversation together so that we're not trying to do this from different spaces and, you know, pulling different levers at the same time, and how do we move forward together? So that's a really big piece of it that stands out for me. Alice, did I miss anything around partnerships?
No, that's perfect. I think we can go to the next slide and then move into our activity in a second. So I just wanted to say, like, as a summary, again, I'm trying to sell you reading the whole report. This is really about expanding access, supporting students, and what Robin just said, making sure that the training and education that we're offering is aligned with community need. And I'm going to editorialize here for a second, which is that I think sometimes there's this sense of like, oh, we do it the Oregon way. It's really different. I want the Oregon way to be a little bit more standardized and just shared. Okay, great. I got a laugh from that, right? Can we make the Oregon way something that works, that's efficient? And again, I really just think I want you to keep in mind the vision. This is a multiple decades long vision, but without it, we're going to keep, I think, stumbling along. So eyes on the prize. The other thing, I think if you just click one more on the slide, whoever's running that, there's another little, oh, okay, that's fine. Yeah, roles for healthcare leaders. We were sort of envisioning, you know, as the Healthcare Industry Council, like what are the ways that what are the roles that people could play? And again, this needs to be a conversation. I think sometimes people come in and be like, oh, don't tell me to do, we can't pay interns, we can't do this. I think it's a conversation that we can start to have about how do we make this work? If we know that, for example, paid internships is a high impact learning practice, how can we work together across, again, sectors and partnerships to make that work? So now I think we're ready for the next slide, and Robin will introduce the interactive piece.
Can I make a comment before?
Please do. Please.
So, Alice, two thoughts on that from an industry partner. I work at Skylake, so before that I worked at Providence, and I was the CHRO for Washington and Montana.
Are you Brian Fix?
Yeah.
No. Okay. Hi.
Hi, Alice. You know, your point about Oregon feeling like we're so special and needing to do things different than other states, you know, be always on the edge, the cutting edge, that is cutting into our ability to serve our population. And I just want to say, like, I don't understand why we believe we have to be an outlier. I'm a 5th generation Oregonian. My family homesteaded Mountain. I've lived in multiple states now. I used to work in high tech, and I grew companies in Oregon, and it's become so challenging we can't get companies to come here. Yes. And the same is in healthcare. And so I am asking as someone who's came back to Oregon, but not sure I can stay in Oregon because of the business climate, I'm asking us to find ways through that. We find the same thing with the nursing, Christian, and not being a compact state, things of that nature. We need to reduce burden.
Yeah.
The hospitals here have 1,300 plus regulations they have to comply with. The average state is 307. Why is my question? And we are struggling for survival. And so I offer you that, wondering if I'm going to stay in Oregon after many years of working here and growing the economy and doing, I used to do this work in high tech as well. But I struggle with where we've gone and what we want for our people in Oregon. And we need to challenge ourselves there. So thank you for bringing that up. And thank you for challenging the difficulty of getting behavioral health workers trained. We struggle with that every day, and we love to create pathways.
Yeah.
Second thing, and it's an encouragement to you, is the question about hey, why can't we do paid interns if that's a great path? It's a wonderful path. We do it in high school. OHA is funding, the last 2 years of what we call the student ambassador program. We train students in the ORs, we train them in multiple units in a hospital, and we train them in outpatient settings. And we do that starting at the high school level with paid internship programs in the summer. It can be done, and it captures their enthusiasm, and it makes them better practitioners. We do it in nursing. Little Sky Lakes has more nurse interns than all the other hospitals in the state for that reason. We have a program that runs twice a year for the transition practice program. That's a 6-month nurse residency. We have 22 slots this summer. We have 200 applicants. So it's important, is what I'm telling you. And I'd encourage you to push that way.
Yeah. Thank you, Brian, for sharing that. I actually have heard you present on the high school pathways program, and I probably misrepresent it, but I talk about it all the time. It's this amazing model. So I'm actually going to be in Klamath Falls next week, so I'll email you offline and maybe we can connect. Yeah.
Yeah. And yeah, I just want to thank you, Brian. I really appreciate it. And I just wanted to tag on that. I mean, same thing. I mean, I'm fifth generation Oregonian. My kids have left the state because they can't find employment here that's meaningful to them. And they love Oregon. They'd love to go back. But the thing that we need to really attend to with behavioral health is our behavioral health, let alone our physical health side. The administrative burden is so significant, we can't even get to the point where we have on-site training for folks under 18, let alone 18 to 23. And so I think this is such a great opportunity.
Good staff in the back.
Well, the regulation on the behavioral health side in Oregon compared to, and I'm on national boards, I go to national presentations. The level of regulation is, I'm going to say, micromanagement of community behavioral health in this state has stymied, along with the low wages, has stymied the ability to grow capacity. There has to be some kind of balance for people who work in the field. And yes, we believe in quality and consumer safety and all those things. And someone who is between the ages of 16 and 22 can do that. They are capable, and there are ways to bring people in, even with, oh my gosh, even without a credential. Do you really have to have a QMHA to be an overnight staff in a mental health residential facility that's low level? No, absolutely not. Why do we require that? And it's just not done in other states. So I just really, I'm excited about this, and I think that Career Pathways is a place in the Career Hub for us to really sit down and analyze as a group, why are we choosing to put this level of constraint on our system? Why? At some point, it must have been a good and important idea. I don't know why now.
Right. Agreed. How all good ideas start out. Yeah. Agreed. Yeah, for those of you that are online, what you don't know is that everybody in the room is nodding and snapping in agreement with the statements that are being made. So thank you both for just speaking those truths, because clearly they resonate. Yeah, so grateful. All right, so we're going to go to just our last piece that we have. I will just share that one of the things that we wanted to say was just that we are just getting started. You know, we have the Behavioral Talent Council report that's led into Bill 4083, and now we're gonna actually go do the things. I'm excited that the governor is looking over all those priorities to figure out where is it we want to focus our time and attention and potentially dollars to do some good work. And that out of that will be where I step in to say, yeah, how do we make this happen, at least on the HEC side? There are other groups that are going to be part of making this happen, but that's where we're going. So just to let you know that we're not done. We are far from done. We're just getting started. And so what I would like to say is, while the governor's priorities are important, in my opinion, so are yours. And so what I'd like to do is just take 5 or 10 minutes to talk in pairs about, you know, when you think of behavior or priorities for the behavioral health workforce, what are the things that stand out for you the most that you could maybe share with me, and I can take that information back to the governor's office to say, look, this is what people are talking about. This is what they care about. And so we're gonna just break into pairs, the person next to you here in the room, have a conversation. I'm gonna pass out index cards so you can write a note for me. And then online, Ronan is gonna put you all in breakout rooms in pairs so you can just chat about what you're thinking. And then when you come back, we'll do a brief share out, and people that are online can drop their ideas in the chat, and we'll capture them that way so that I can print them out and have everything in my hot little hands to help carry forward. So any questions about what we're doing next?
Robin, remember, I have a 10:50 hard stop, so you all can keep going, but if I disappear to everyone, thank you so much. It was a great pleasure to
We're
present.
gonna keep you, Alice. We're keeping
Okay,
you. So
until,
we'll go for about
until
5
10:50.
minutes.
Yep.
Yeah, we'll go for about 5 minutes in pairs, and then we'll come back.
Okay.
Sound okay? Okay, all right, so find your person, and I'll come around with index cards. Thanks, Ronan. I know nothing about healthcare.
Hi, Robin. Liz. All the things.
Oh.
All the things we.
I don't get it. I look forward to working. Coming in.
Yeah. I'd love to go through
Not really, sort of.
Are working on
Family support services.
priorities, different,
So.
priorities, but also large section.
This group did
So they're working with us on.
Which makes sense.
Mental and behavioral health.
Yeah.
Yeah.
Or behavioral health, I'm sure which one is first, but. They go hand in hand. And then that's under healthcare and human services. Advanced. But after that. The national.
I think like.
But we're having conversations.
I think that's one of our.
Trying to figure out alignment.
Yeah, sure.
And on that, selection to. I want to talk to you.
Oh, sure.
I want to see what.
We all remind her. Because getting the kids.
Yeah.
Getting young people, even younger, like middle school, awareness is so important.
Yeah. We offer 6 grants. Not just behavioral
Well,
health,
and so we don't even really have.
for. It'd be fun to kind of just like over about, and then a few others.
I mean, I would like to see more.
We have ideas.
Yeah.
Well, that's a separate. Yeah, that's the behavioral health vision.
Oh, okay. Yeah. Cool.
Because we sit in a different part of the
Yeah.
Our priorities in terms of making sure. So the things that we're talking about on here, but I think
come back. And we'll do a quick check-in before we take a break, right? Okay, so bringing everybody back. I was just hoping that we could take a minute before Alice has to leave us. If you are online and you've had a chance to to come up with ideas. You can pop them in the chat, or you can unmute or speak and raise your hand, and I'm gonna offer the same thing to our folks that are in person. If there's anything that's standing out for you that you want to share with the whole, please feel free to jump in. So I'll just open up either way, online or in person. Anybody got anything they want to add before we shift into taking a break? Sheila, sadly, you're the only person on camera in the room, so just know, like, I'm staring at you.
Well, I will happily go if you want me to, and that will preserve me from having to type it all. So I was just about ready to do that.
Oh, please do.
All right. Well, one, Robin, amazing to see you.
Two.
And two, so my group I was with was Duncan Wise and Brian Boeninger. Sorry if I've messed up your last name, Brian. But our quick feedback is, one, this is fabulous. We're all recognizing that this is an incredible template, taking and celebrating the report, but not just celebrating the report, taking and going to the next step. And we all kind of talked about how this could really be a template beyond behavioral health as we think about the pathways for not only healthcare workforce, but maybe even other workforce gaps. So that was one of the topics we talked about. To the whole stackable credentials, absolutely a pathway that should be done. And we say go big, use this as a template for others. And we did have a short conversation around making sure that as we think about the stackable credentials piece, we're thinking about how do we engage K through 12? How do we engage higher education? And how do we engage the workforce, the employer? And making all of them part of the solution as we think about navigating an individual from their high school experience, inspiring them in various careers into their higher education multiple times as they gain additional credentials in their career pathway, and making sure that our employers are engaged in that. So the whole idea of the consortium is probably where you get those minds to be thinking from all of those sectors. So I'm sure there's something, but we felt like there were other groups that probably would pick up on other ideas. So I'll leave it there.
Love that. Thanks for jumping in, Sheila. Appreciate the feedback. That's great. Anybody, we'll switch off. Anybody in the in-person space want to jump in? Something that stands out?
Sure, I can.
Please.
I just heard Sheila say a whole bunch of the things that I had written down on my card.
And
so-
Dave, do you want to tell people who you are?
Sure, I'm Dave Fuller. I'm the provost at Rowe Community College. And so how are we able to ensure that we have the most appropriate transfer degrees related to behavioral health? And using the guided pathways model, right? How do we build that out specifically for behavioral health pathways? And how do we connect to high school partners, universities, and industry to create a seamless experience for students?
Yeah, excellent. Thanks. I see you, Heather.
I'll try and put it in summary. The group here talked a lot, like Brian and I kind of brought this up earlier, Brian started off with Brian. But how can we use this opportunity to take a look at making sure we're removing administrative barriers and other barriers as an entire statewide system from the Oregon Health Authority, because really that is where a lot of those administration functions happen, to support the entire continuum of care, and to ensure that when we do ask people to take the time, money, and investment to go get a license or a credential, that they're allowed to work at the top of their scope, because so much of our barriers, this is maybe one example I'm going to generalize from our conversation, so much of the barriers actually require a license or a credential in Oregon that probably is larger than the job duty. And so how do we make sure, and we love to create credentials and licenses in Oregon, and how do we make sure that when we're doing that, we're doing it mindfully and that people are actually prepared for a job where they get to work at the top of their scope and that we're not requiring a licensed clinical social worker to do case management. And so how do we, and that they're actually doing the work that they put all that time and energy into, like you said, they're doing the job they wanted to do.
Yeah.
They're doing the job they wanted to do, not case management. They wanted to work with people on clinical issues to help them with their healthcare needs. And so how do we create a system that really is driven by those things, enabling healthcare businesses to thrive, the workforce to thrive, and that we're encouraging people to work at the top of their scope with safety and consumer outcomes.
Love that. Yeah. Thanks, appreciate it. All right, we have time for maybe one more person online. If anybody wants to jump in, it's good to see faces. Yeah, thanks.
Hello, I'm Jana Bitton. I'm with the Oregon Center for Nursing. I may have frozen, but apparently I'm back.
Nope.
I was lucky enough to get in with our newest member, Maria Carrillo. So thank you to Maria. We had two things. Maria brought up a really good point about something that wasn't necessarily discussed, but maybe something to consider as you're implementing it. What are some incentives that we can do about providers that have different languages and different language skills, so that the behavioral health providers that we're trying to grow in our state speak the language of the patients that they are going to be treating. So that was one really good point that she brought up. The thought that I have is that everything on your slide and your entire presentation is so familiar from what they were talking about 25 years ago around the nursing workforce. This is not, like you said, this is not new.
Right.
What I really wanted to just let you know is that everything that you described for nursing, it worked. They were able to grow nursing programs. They were able to get good pipelines. It also got a lot more complicated and a lot more frustrating. So I would just say, as you are implementing this and as you're going through the process and the work that you're doing, maybe learn a lesson from the nurses and think about, if it's starting to get a little bit more complicated than you think it should be, is there a way to simplify it for the benefit of the students that are going through that pathway and that pipeline, or just kind of keep everything clear as you go so that you're not looking a quarter century later and saying, wow, we put a lot of regulations on this that I don't think we necessarily needed to. So that would be my only recommendation. But otherwise, I'm really excited about this. This is a really good report and really good work.
Thanks, Jana. I will always follow the nurses. They know what they're doing, for sure. Yeah, thanks everybody for taking time to think about this and share your ideas and thoughts. I'm gonna keep all that close to the chest as we continue to move the work forward, and I look forward to staying involved and engaged. Please feel free to reach out to me if you are in the behavioral health workforce space. My goal is to start connecting with y'all so that we can start doing more work and thinking about maybe even a subcommittee or something, so we can start talking about how do we help bring this group that's already doing such amazing work into the conversation about the priorities that we want to implement, because you all have the wisdom for sure. So that's what I got. And thank you, Alice. I know you left a little early, but we appreciate being in the space with you. And okay, how long will it take for a break, Daria?
Yes, so everybody, right now we will be joining for a short break. We have 10 minutes, so please come back for folks online and here at 11 o'clock sharp, and we will start with, 11 o'clock. It is already 11. Okay, let's take 5 minutes. Yeah. Let's take 5 minutes, everybody.
Thank y'all.
All right. Great. All right, for the folks online, we're back. And for the folks here in person, we're back as well. All right, everybody, let's get back. We will start to discuss the strategic plan. So in your folders, you will see the strategic draft plan. And along with that, you have a strategic work plan review discussion guide. And I believe folks online can access it through the hack website as well. That's the materials that you sent earlier. So before I break you guys into groups, we will have one group here in person and we'll have two groups online. I would like to point your attention to the strategic work plan review. So this is a very working draft, and I know that I've socialized with some of you the draft before, so we've done many edits, but this is not the end. However, we're very close to it. What I want us to do during that time when you are in small groups is really to think as you discuss all those questions, and I know it is pretty ambitious, there are pretty deep questions, so 1 hour is not enough or in 40 minutes. However, we've talked about it so many times, and I still really truly want to move from convening to action. So as you're discussing, keep one thing in mind. So what is different today? What am I walking out from this meeting? I'm gonna do something. What is that one thing that this consortium is going to do? Actually, action, rather than we'll meet again and we'll report out again. We will report on our outcome of that one action. And so what is it? So think of top 2 priorities that you will identify in the next 0 to 6 months that we will work on. Maybe one specific barrier, name one partner. So overall, think of what should we do, who owns it, and what starts today, right now. I'll be working on all of those comments. I'll be reviewing the minutes starting tomorrow. So I'll start working tomorrow and I'll be pulling you into this work along with me. And if you look at the strategic plan, does it describe the role that you envision for this healthcare consortium that we can play in the state? Is it what it is, or does it must it be something else? And if you look at the alignment with Q1 in the strategic plan, you'll see that we're starting with a feedback from Q1. So what critical Q1 ideas are missing and must be included to make this plan credible? In your minutes, you will find this in your folder. You will find on pages 6 and 7 the summary of all of those ideas. Right, so we have no more questions. We're ready to break into groups. We'll have 2 groups online, and then we'll have 1 group here. And let's come back at 11:50.
Okay, y'all, we're a small group.
Yeah, one small group.
So if you want to move closer, feel free, but I think I can do this.
can show CTE concentrators and observations, you will, and you expand that across the state, find ways to do that.
Love it. I love it. Thank you all for sharing your ideas. I wish we could keep talking and coming up with more things to change the world. Y'all are just getting me started. But I'm gonna turn it back over to Daria, and we'll hear from everybody online.
Yes, thank you for the group here. Hillary, did you take the last call? Yes. Yes, thank you so much. All right, so for the folks here, you can think while we're listening to the folks online, who's gonna report out on the key actions or what needs to happen. Also, lunch is available. That is a working lunch, so you can grab it for that. But let's start with the folks online. We have two groups, Heather and Shonda. Either group would like to go first? All right, Shonda?
Well, if we're not gonna say anything, I will fill the time. So I was in
Yes,
I was in Shonda's,
yeah.
I was in Shonda's group and I was elected to be the speaker, so.
Perfect.
I'll
Let's
get
go,
to hear
Shonda.
from you.
Thank you.
Thank you. All right, so we looked at the strategic work plan. We worked at the strategic work plan discussion guide. Shonda was amazing at trying to keep us on topic and answering all the questions, even though the people in our group tried very, very hard not to answer the questions, but she did great. The one part that we did get a little bit stuck on is the strategic plan, the strategic work plan purpose statement. And I didn't see that anywhere. So I wasn't really clear on that strategic plan plan purpose statement.
Yes, Jana, thank you for bringing that up. I messaged some of the folks who were taking notes. I should have set us up in the very beginning. This will come out after these discussions. I will make one clear, but I needed your voices to make that happen. So that is going to come through right after.
Okay, so we didn't comment on that because we didn't have that. But what we did talk about is how important it is that this group have some alignment about what it can do going forward. The purpose of this group when we first got together was really about informing the Future Ready Oregon grants. Now that that program has expired, we really do need to refine what our purpose is and the reasons why we get together. I think, and we talked about how it, while interesting to get report outs on different things that are happening around the state, for example, the behavioral health workforce plan and the rural health transformation program, those are interesting. And I've heard those conversations and I've been part of those conversations in other work groups. So if it really is just to do a report out of the things that are already happening in the state, I don't know that that's necessarily a good use of our time. And that was what we really talked about. However, this group has an amazing opportunity. If we are all aligned and we all have the same goal, which is, and I'm not going to presume that this is also your goal for getting together, but my goal for coming here is I want everyone in Oregon to be able to access healthcare and be healthy. And I want to work on the problems that are related to the workforce. If there's a workforce gap that's stopping someone from being able to access healthcare, that's where I want to be involved. And even though I'm so niche and I'm into nursing, I don't have any illusions that nursing is all alone in this. It's an ecosystem. Nursing relies on CNAs and MAs and MDs and PAs and all of the different humans and all the administrators and everybody that works within the system to keep it going. So I would say, if we can get aligned on something around that, if that's our ultimate goal, and we want to attack this problem from a workforce perspective, there's a really big opportunity here. I don't know if you did this on purpose, but you may have made a mistake by putting me and Brian Boringer together because we've had many conversations about this. So we kind of went a little ham on this particular topic, and which is Oregon, we are so great at collecting data. We've got the Oregon Employment Department, the Healthcare Workforce Reporting Program. HEC has some data that we collect. Yeah, so much. OCN collects data. The Medical Association, everybody collects data, but all of the data that we have, it's kind of like we're just describing one little piece and we're missing the point. When we go and when policymakers are trying to make decisions, Often they're just working with whatever piece of paper has been given to them, and they're working off of that. Wouldn't it be great if we're talking about making sure that healthcare and the people of Oregon have access to healthcare? Wouldn't it be amazing if the policies that we were passing were informed by all of the data and all of the evidence that we're collecting? And we can make some really, that's where the opportunity could come for this group, where we could dial in that data so that we could better understand where the shortage is and where we could focus our energy. And one of the things that Brian said that I thought was really good, our energy is not just money. We heard from Kyle, there's no money. We're not talking about money. But this is not a new program. This exists. And if the funding for this and for the funding for bringing us all together, if that exists and it could potentially go forward, what an incredible opportunity to start looking at this coordination, this workforce development, and also the recommendations for investment. We're going into lean years. That doesn't mean that we're always going to be here. There is going to be a time that comes up again in the future. Maybe not in our time, but there will come a time when there's more money for healthcare. How can we really be precise about what we're putting our energy into to support our workforce? I think that's it. The last thing I said is those presentations that we get, with like, for example, the RHTP and the behavioral health, it's not that we don't want them. It's not that I don't want them. It's just, I think we're ready for the 201 version of that instead of the 101. We don't need to hear where the money came from, the one big beautiful bill, the $197 million. We know that, we're clear on that. We might need to hear what the next part is. What are the tribes going to be doing with that money? The impact awards that have already been given, how did they get chosen? What was it about those that the state decided? They were like, let's just go right into that. What kind of things are they hoping to achieve out of these Catalyst awards? I think that would be a little bit more interesting to me.
Okay, perfect. I love it. Yes, fantastic. Yes, that was on purpose. And also, yes, heard enough. Now what? Yes, thank you.
You're welcome.
Yes.
And
okay,
I've got the report out for the other group, and I'm going to say a lot of ditto. We also talked a lot about the data, and Daria, I was going to message you separately. I'm also on a HEC work group called the SSCM review, which is about the funding for higher education. And they had people presenting amazing data, and that was just last Monday. So I was going to get you over to Kayla Winslow to connect on that. But I completely agree. Our group talked a lot about, we need to make sure we understand the supply and demand data across all healthcare, that we're not leaving stuff out. Like we talked extensively about dental and primary care and acute care and behavioral health and everything else. We also said we need to have a clear framework for what we're going to do with that data and how we get decisions and priorities made. And we should make those criteria, that rubric, we should do it before we get the data. Because once that data comes in, we're going to be, we could chase all kinds of threads. And so then we moved over into, and I love that Jenny, your group did this too. We ended up being, again, community and patient-centered in our priority, which is how do we close the gap to access? And how do we make sure that that is done in a way that represents all areas of the state, right? So the need to close access in the Portland metro area might be different than it is down in Southern Oregon and Eastern Ontario area, right? So we want to make sure that we've got clear criteria for how we use that data, and that it's going to need to inform policy and practice, because it may not be funding. So then we talked about, we need to make sure, like when we talked about what leadership is needed, I actually kind of pointed back at the presentation on behavioral health and says it needs to start at the governor's office. If it doesn't start there, it's not going to get traction. And the fact that like behavioral health is getting the attention it's getting, then we need to figure out through policy and regulations, because we all talk about how Oregon is great at regulations. And Jana, your example of 25 years of learned history is, what can we use the data to inform that says, where is friction in the pathway? Where are we actually getting in our own way? What can we do that doesn't necessarily need money to actually improve access and pathways and navigation, because we put the burden on the navigator, the person trying to find the program. We put the burden of the funding on them. So we talked about, the data might tell us where the gap is, but then we need to like literally root cause it and dive down into it and figure out what's getting in the way. Same thing is true of like where programs are and how they're stood up and how people access those programs. And then we talked about how do we help ensure that people in the communities where they want to stay and serve their community, that they have access to the pathways and the ability to return to their communities to drive retention in their areas. And so we talked about grow your own models, or are there other ways to expand access into programs and pathways that don't necessarily pull people out of their communities and cause them to not be able to return, or drive like that, just the turning of the folks. They get out there, they do the job, they leave. So team, chime in if I missed anything, but I think that was the gist of it.
Thank you. Yeah, this is it. Thank you, Kathy. And that's so true. When I joined the consortium, I started in this role. I started to meet with all of you, our members, and then started to see also to attend different meetings with workforce boards and thinking, all right, so what makes us so different from everybody else at the state level? Something that we can help those folks who are on the field, who are helping the communities, that bring it back to us, that problem. We identify that gap, we take that region and we help at the state level, we bring it back to the governor's office, however it works. And we are also in that unique, I guess, lucky stage where we do have data. That's very true, John. We have so much data so that we can rely on that, unlike some other consortia that unfortunately don't have that all data available to them. So yes, that's exactly what needs to happen. Thank you so much. Both groups online reported out amazing reports. We have one more group here left. Does anybody want to just sum up a few minutes of what we discussed here? And that would be it. Okay. It is a working life, so you can talk.
I'll try and summarize.
Thank you,
Please,
Heather.
somebody chip in if I miss a bullet. We talked about many of the same things that the other two groups talked about, but we in particular bringing that we have a unique opportunity being a cross-sectional, multidisciplinary commission, that we're bringing in data from all of the parties, the employers, the educators, the industry leaders, and that making sure that that data we use is meaningful to our objectives, and that we can use it to drive potential policies and support successful workforce recruitment, engagement, and retention across the entire healthcare sector, both behavioral health and physical health. And a lot of talk about primary care and behavioral health. And then the other big piece that we did talk about here that wasn't covered quite as much in the group was recruiting the audience and making sure that we're diving into working with our K-12 partners, and making sure that we're creating awareness and acknowledgement. We joked, we called it behavioral health influencers and primary care influencers, that we're getting the attention and making our pathways both relevant by making them experiential and practical with skills at the employer sites, and combining that mindfully with efficient, relevant educational pathways so that we keep our audience of future professionals engaged and excited about coming into the field. So I'd say that was, we talked about all the other things the other groups talked about, and that's great, we were all aligned, but that was one piece that we talked quite a bit about, and we shared some different best practices and things across the state that are happening already that we could leverage and support and learn from. But that was a piece that was different. I don't know if there was anything else different that we covered in our group that I missed, but that was a big one.
Yes, thank you. I think it captures everything, even more in detail. Yeah.
Good summary.
Yeah, that's fantastic summary. Thank you, Heather. So thank you for the folks online, to those folks online, people here. Thank you very much. Now we'll take a short break. until 12:20, and then we'll start with Lane ESD and the student panel presenting. So enjoy your short break.
A bunch of students next door.
Yes, they are. They're so excited and worried, I know.
You're gonna more than double the size.
Yes. For the folks online, welcome back. We are back with Lane ESD program, starting with the student panel, and we just have a few minutes before we get it going.
Good afternoon. Thank you and welcome. I know many of you have already been here for a while, but welcome to all the students and other folks that have joined us. My name is Shereen Vogel, and I am part of the Lane ESD team that supports free technical education. And before I get started, I want to just recognize a few folks in the room that are part of our team. Ariana Schwartz, if you don't mind standing. She is the Program of Study and Teacher Licensure Specialist Extraordinaire. And we have Hannah Everly, who's the Career Connected Learning Program Coordinator, also amazing. Cassidy Mitchell, who is the one of the directors of the School Improvement Team and is the administrator that oversees CE. Thank you. Casey Reid, who's been here. She is part of the team, and I think that's it. Yes. Okay, so I'm going to do a very brief and quick overview of sort of the big picture of CTE in the county, kind of give you a picture of sort of how we got here, because this is not by accident. And then we're going to take it away and move it to the kind of the best part, I would say. So if you don't mind. So just for a quick overview, in the county, for those of you that are maybe not as familiar with Lane County, but we have 16 school districts that the ESD supports. And within those, there are 111 approved CTE programs. Every single high school in Lane County has at least one program. And it also includes about 154 licensed educators that we're supporting in ICFU. So that's sort of the big landscape. Next slide, please. Of those, yes, thank you. Of those 111 programs, that breaks down across career clusters. And for the purposes of today, we're going to be really focused on health sciences, but we have 10 across the county in different high schools. But you can see that there's a whole array of different careers that are supported, right? The one thing that I want to point out is you'll notice the trend over the last 10 to 12 years, there's been an explosion of CTE programs, nearly doubling within that period of time. So there's a need, there's growing need, and so that's what we got today. Next slide. So just also kind of just for context, as a consortium, so this is all of our 16 school districts, it's our workforce partners, it's the community college. As a collective, we have agreed to really focus on these priorities, to spend our money, to spend our energy, spend our time and resources. And it's really focused on program alignment with the community colleges, dual credit, it's increasing industry credentials, it's doing things like creating more access to learning. And then the number 3, which is like regional CTE access, that's really kind of what you're going to see today, is some of that really opening up opportunities and creating access, whether you're a student in Oak Ridge or you're a student in Florence, you have equal opportunities to engage. Professional development and student voice. So hearing from the folks that are actually in the field doing it, our students, hearing from them what their needs are, what sort of recommendations they have, and making adjustments. So, yeah, their priorities. Yes. Were you going to ask? Oh, I'm waiting for somebody to start. Oh, okay. So this is just a really quick. Again, we did not get here by accident. And this is kind of this is a snapshot of what led us to this point today with health sciences. Going back to 2013, there was kind of this foundational work. There was a steering committee that got together. It was folks from Lane Community College. It was folks from the ESD. It was from our high schools. They came together and they said, what would it look like to do regional health sciences work? And a model was developed. out of that work. And Kelly, I don't know if you were sort of around, yes, really instrumental. We were really fortunate in 2014, ESD received its first ODE revitalization grant. This money really infused and kind of like set us off to the races. The biggest piece of that, I would say, is the teacher-to-teacher model. So teachers were put at the community college alongside faculty with sort of like a fast-paced summer program to be able to get licensed and be able to go in and basically start a program of study in their schools. We went from 3 health science programs to 11. That's crazy. Like that was like, whoo, we are off. 2016 now, just sort of like moving forward. Okay, now how are we going to support all these programs? What does that look like? MedSplash was a critical piece of that, kind of a cornerstone of that career awareness. We'll hear about that in a second. And then another revitalization grant that really infused sort of that professional development and student certifications came about. And then here's the piece that is like, I think really exciting is that even with all of these programs, there still was a need for more access, for other programming that didn't exist. And so the superintendents all came together, the ESD got on board, and out of that was launched the Lane Career Academy, which is regional CTE opportunities that really expanded beyond just the single district, but kind of able to fill those gaps in areas that schools can't necessarily do, but also opening up opportunities for students who don't have a health science program in their school. And out of that, the behavioral health and the emergency services programs were born, which they're in their pilot year. You're gonna hear a lot more about it. Also, for supporting those health science programs in the schools, we have, and I'm gonna introduce Carrie, thank you. Carrie Pilgrim, who is our lead health science teacher who supports teachers around the county, who is essentially the spearheader of this regional validator, clinical validator model, and I'm going to have her take a couple minutes to explain that. And just want to celebrate MedSplash is in its 10th year. So, yeah. And with that, I'm going to pause there for a minute before the next slide. Gary, do you mind just taking a couple minutes and just talking about the validating?
Hi folks, my name is Carrie Pilgrim and I run Churchill's Health Services Pathway here in West Eugene. And I have the pleasure working for the Lane ESD as their health CTE, PLC lead, that is the title. You know, excuse my untimely arrival of classes, and as you know, if you teach these sorts of topics, the standard subs can't cover it. So, so here we are. The clinical validator model is really something that we developed to help create a bridge between industry and the classroom that is practical and that is meaningful for both the student and the practitioner. I'm sure if you think about, for those of you who have licenses, we all have that moment where we move from classroom concepts to like application of the skill. And most of the time, we think about the application of the skill happening in situ, like in the facility, and you get to do your hands-on, and that's where you really know if you know your set. However, if you think about it from an education perspective and an educator's perspective or a learner's perspective, critical link in that process is the feedback that you get from your preceptor, right? And it's the feedback that you sometimes get in the lab from your clinical educator, right? And so if that is really the most critical piece that we can offer it in the classroom, right? Because it's very difficult to get youth into facilities because of numbers, right? Equitably, like I want all my students to have that clinical observation process. In facilities, I have 50. So I don't expect you to shove 50 of them into your spaces. That's not practical. Would I like it to happen in like a small batch sort of situation? Sure. But it's not practical when you then multiply that out by 11 different pathways or more if we're successful in raising more. So how can we get the most bang for our buck? What if we take the practitioner and bring them into the classroom and allow them to do that preceptor work in CQ, like in the classroom? So if you were coming to my classroom, I would tell you, oh, I see that you have nursing experience. Cool. We're doing a unit on vital signs. Students are learning vital signs. I would love to come in, for you to come in at any time during the course of my teaching vital signs and interact with my students. In the clinical validator model, you don't have to prepare a presentation. You don't have to give a big speech. You just walk in with the skills that you have and you watch the students actually doing the work of learning. And then you provide feedback. It's like I do, right? You can provide the skills and tips and tricks of the trade that helped you out in your industry practices. And you can also provide insights as to how those skills may be applied differently in particular situations, which makes the learning more like valid and real, right? Not to mention your presence increases performance in the classroom because it's a new face and you have the chance to see how our practices actually work, right? Another one of the big barriers that we identified is that as CTE programs, we're working with high school students, and most of the time, those students are under the age of 18. And so risk management is like, nope, we don't want anything to do with that. You're not certified and they're too young. And we want to dispel that myth that they don't have a place in your practices. Because certainly we all hire people who are not certified. And certainly that is all just posted on Indeed and Craigslist and all of those other spaces. And you're getting some random person off the street that you know nothing about. And then you're trying to retain and train that person. What if you have a program that has students who really want to enter the healthcare field, who already have foundational knowledge that exceed the average person off the street, who have a maturity level, who just need access to your spaces to be committed to going up that ladder, that career ladder in your facilities. This clinical validator allows you a window into our spaces to see just how prepared and mature they are, to see their thought processes, their critical thinking, and to help guide them along the way and build the relationships that you want to build from the start so that they don't just apply to college and leave the state. So a low lift for industry, a high impact for all parties concerned. We're hoping to get this model with some examples of what that could look like, though it is very flexible for teacher and unit, up and going on Career Ready Lane and some other spaces so that you can start to participate. But certainly if you are inspired at this point and you're like, I want to do that, you could do it now. You can contact any of these fine teachers and we would be more than happy to like bring you into our spaces and have you share your expertise. Cool.
This is the final little bit, and then we're gonna hand it off. But we wanted to give you a quick little insight into MedSplash because we think that is a very special piece that we're very proud of. And the person who coordinates that is Hannah.
Yeah, so MedSplash is essentially it's a career exploration program. In the summer, we bring students from all across Lane County to LCC, and we spend 2 weeks exploring healthcare careers. I think we cover 15 plus careers in those 2 weeks, and it's very hands-on. We bring in guest speakers, we go out to healthcare facilities, and it really helps students kind of jumpstart their interests, their career thought process, and kind of helps guide them as they go through the rest of their high school career, if they're gonna go into a health sciences pathway, or as they're launching post high school into their next steps. And we have a short video from last summer that just kind of talks a little bit, and the students share their experience. So we wanted to share that with you. If it works.
If it works. Is it working?
Hold on 1 second.
Probably will. No, we won't. It will.
Oh.
I know I'm glad you this.
Sorry.
Oh, that's loud already.
Remember when I fixed, was anybody in the room when I fixed it last time? I did fix it. I have fixed it. Okay, I think I know what you need to do.
Okay.
You need to go to the speaker output and change that, I think. You were there. You were there when I fixed it. It was the
but I
MEP
was
meeting.
not
What did
paying
I do?
attention.
While they're working, I'll just ask, has anybody here done med splash?
Your child did?
Yeah.
Oh,
Your So Alexa's done med splash. Would you like to share a little bit about your experience?
Overall, I just met like the most wonderful people. I had amazing days and amazing instructors. So I feel like we did some pretty fun stuff. It was really fun to like show me and stuff and really like the students that lane at the time of me, and that was really fun to kind of practice and working with those students were also like on the move for me because it was EMT.
Yeah, it was the summer EMT class.
Yeah. I would say it is an overall experience, and I met amazing people. And I hope to be back this summer as a PA.
Okay, well, we can share the video.
Yeah. Keep on moving. We're running out of time. So just to keep us moving, sorry. I can say really this, but maybe if we can transition.
Thank you.
Hands-on activities that we've been learning and getting the opportunity to.
Definitely kind of just the environment, like making new friends and just how people are really kind, you know, like especially like you don't have your phones. I think that's so cool. I mean, it really kind of forces you to talk to people, right? And I think that's beautiful.
My favorite activity is always at the beginning of the day when we do like a team building activity.
The injecting, just because it's very hands-on and you got to learn like different skills.
We're gonna learn more about what it takes to become like a dental hygienist, a dental assistant, and what you need to do to be a dental hygienist.
We rode around wheelchairs. I just kind of felt like so much sympathy towards people who have less abilities to walk. You take that for granted sometimes, so it kind of like put me in their shoes.
I personally did the thing where you get to chew on this little like purple tablet and it shows all the like spots on your teeth or you get plaque.
The field trips that we've gone to also expand not only on what does a day-to-day life of this particular field do, but also like how did they get there? What are the steps? On Thursday, we're gonna go to the Riverbend Hospital. We've done like how to measure blood pressure.
Learning about how to do ultrasounds on people and learning where all the organs are in the human body. I found that really interesting, seeing the close-ups of the heart.
MedSplash is a very useful tool for learning what you think you might want to do.
I really appreciate the opportunity that MedSplash gave me in exploring the different medical professions out there, especially since I'm not too sure on which path I want to take.
We learned how to tape our ankles just in case, and on Sunday, I rolled my ankle and it was hurting, and I just had some tape that we had left over from that day, and I taped my ankle and it was fine and I could walk.
I've kind of been looking at EMT and like paramedics and stuff, which I was like originally like, I don't want to do fire truck stuff. I don't want to do that. And now it's like, oh, there's like a whole nother side that I actually like really enjoy.
My experiences here will definitely impact my future because it helped narrow down my career choices. We've met a lot of different people from a lot of different professions. It's a way to explore your career pathways. It's a way for you to try out different things. You should probably take advantage of this opportunity.
Every little thing we do has a purpose. The teachers are amazing.
It'll give you an idea where to start.
A little bit of everything. Take advantage of the opportunity while you still can and step out of your comfort zone because it's definitely worth it.
Everyone. So we're going to transition into talking a little bit about our behavioral health pathway program. And we're going to go pretty fast to these first few slides. Ronan, so sorry. So we can get into our students panel. I'm so excited. As a reminder, everyone, we'll start with names, schools, pronouns, all that kind of good stuff. We'll do that first before we go through our questions. So just be getting ourselves settled. So hello, everyone. My name is Casey Reid, she, her pronouns. As I like to say when I'm traveling around the county, I'm your behavioral health pathway specialist. Not because I'm necessarily all that much of a specialist. I've spent a lot of my career in higher education, doing these kinds of early college programs, first year student success and retention programs, that sort of thing in 4 different states, with over 6,000 students at this point. So I'm really happy to be here back in Oregon to talk about Oregon's 3rd ever behavioral health pathway program. And in our first year, we are already the largest, which is also exciting. So we'll get to hear a little bit more. I want to make sure I don't get too ahead of our presentation. Awesome. Thank you. Yay. Next up. So I want to get a little bit into the needs of the program. I think it's always important that we rehash a few of these statistics to understand a little bit about Wayne County and what's going on very specifically here. So if we could click in. Thank you. We have a huge county. If you haven't been roaming around Wayne County anytime recently, we are larger than some states on the East Coast. So I want to say thank you to Tony, for instance, who just got here from Mapleton. It took an hour ride to get here, to be with you here today. So it's been really fun to have one of the largest counties in the state, as well as one of the most populous counties in the state, with an exceedingly high unmet need for providers, particularly in our rural areas, where we may have, oh, and by the way, before I move on, mental health support is the #1 priority, according to our Student Voice Summit. So this is something our students want. 12 of our 16 school districts identify this as a priority. If we can click to the next slide, please. But we don't have enough people, right? Which brings a lot of different issues for trying to do this program. Next slide, please. And I'm going to just highlight. This is Wayne County right here. We have an unmet needs score of 49. Next slide, please. And we have a decrease in our behavioral health course taking happening here as well. So at LCC, we've had a decrease of 21%. At UO, a decrease of 5%. And compared to all 4 years, we look like we're a little bit better, but still, we don't have as many students who are going in. Next slide, please. And yet, we have a huge anticipated need in the county in the next few years. We have a lane stabilization center coming in. We are anticipating just with that and the other related projects that we are going to have someone that may look at 300 extra jobs. So we've been working really closely with the folks on those projects to try to make sure that we're figuring out what do we do? How do we get this need met? Because we can't just poach from existing employers. That's not helpful. And a range of other things. So next slide, please. So we're trying really hard to make this a very connected and contextual experience. Our program looks radically different than the other 2 programs in the state. Rather than having students bus in, we go out. And so let me show you what that looks like. Next slide, please.
So we have a 4-component model. I must say, I want to give huge props to those of you who did all of the work on these behavioral health talent assessment reports. They have been highly influential to creating this program. We have started from the fact that burnout is a problem to build everything around this program. And so in addition to the fact that our education component includes a high school class that counts for health credits, which is a unique component of our program, and it also counts as our brand new, I am technically a dual-ish sort of teacher. I am our teacher for our non-credits LCC behavioral health classes and certificates, which is new to the state. We also have credentialing like all of the other programs. That's not unusual. We have some experience built in, also not unusual that it looks a little different in our context because we're in rural areas. We have a huge mentoring component. And so some of the students that you see here and some who are in our fabulous, in the audience, but not choosing to speak today, and that's okay, are farther along in the behavioral health pathway. They are from LCC and UO's human services programs, because we're trying to create a whole chain of mentoring across, in addition to the professional connections that students get as part of the program. This is part of the QMHA pilot through MACBO, so students can earn up to a year of credits, depending on how this rolls out. Next slide, please. And we're really trying to emphasize real experience with professionals to make this look distinguished from taking just IB psych classes in high school, right? We want to make sure people are getting something real. So we start at base with mental health wellness skills. That has got to be the foundation, right? And so that's part of why this counts as health credits, because we do a lot of health-oriented sort of education. We really try to work and infuse a lot of employability skills that also double as behavioral wellness skills. Isn't it great when that happens? So motivational interviewing, for instance, is a core component, attunement, listening, right? Things that are pretty foundational, but that we all need some extra practice with, right? Really trying to shape up and offer peer support. And so some of our students up here from Cresswell have been instrumental in getting a wellness center created. That is going to be coming up next year in their school, and they are in the process of creating a peer support, peer listening program. I think the first of its kind in Lane County. Networking with professionals. You'll hear from some of our professionals who have been in the classroom with us. We've been trying to really make sure that there's lots of professional connection and support, because again, we're out in rural areas. Right now, we are watching a lot of our counselors be cuts. We don't even have counselors on the ground, never mind behavioral health support for outside of school. And so that has implications for how we're trying to run this program, which we can talk about separately some other time. We're trying for some free college credits and certificates, trips. This is a picture from Balmer Institute, where several of the students you see up here went and visited Portland. 5 of the 12 students who went were from Sayusla out on the coast. Sayusla has really been sort of soaking up things, and that's been, I love that drive. I drive that drive so much. So fun things, cool things happening. Next slide, please. So right now, we're looking at, you have a lot more in-depth demographic breakdown of statistics in the handout there. 73 students, that's not counting all of the other students who have been invited and been part of our youth peer support specialist training over spring break, for instance, the college class we paid for through LCC, and a lot of our other opportunities and educational events. 12 schools are currently represented at 5 pilot sites, including online. We're looking at least 5 more schools next year. The community, I can't even keep up with our community partner list. That's what it looked like in February. It's much longer than that now. So that's from our Design Collective Summit. We partnered with 3 high schools, graphic design programs, to create a new logo for the program, which you see on your handouts in the corner. That was really fun. Next one, please. So this is what we look like right now in the county, to give you a sense. In-person sites are the circles, online certs are the little Pac-Mans, and then the anticipated are white circles, where we're going to have more students either in person or online. Next slide, please. We're really trying to work to build a culture of schools. This is huge. Mental health stigma looks different these days, but it still runs deep. And so this is something we're definitely kind of working through and working with. And so we have partnered really closely to build capacity for things like our sources of strength programming across Lane County, which we are down from 2 to 1 person at our Lane County Public Health doing that work for the entire county. And so we've been trying to help build capacity for that as much as possible. In addition to just doing socio-emotional learning, different things like that. Next slide, please. And then we have a few different unique features. So we have this ESC-driven model, which I think could be powerful in other parts of the state and is something to think about. Not everywhere perhaps, but it is a possibility because we do have some different dynamics at the community colleges here than we do in other states that I have been in. Where in other states I have been in, where I have worked extensively with building early college programs, the 2-year level mostly is doing AAOT work. And so you don't get, what we have here is historically in Oregon, our human services programs at the 2-year level have really been built out as CTE-driven programs that are highly specialized and usually for non-traditional student populations. And there is nothing, that's fabulous work, that's great. But that is not always a great fit for the early college context. And there's been some unique things that we've had to navigate to try to make things kind of work there. But we would love to see that we're working more towards that direction in the future. There's some good models out in other parts of the country. Happy to talk about that. Again, the core high school curriculum, having the non-credit college element that we're hoping will count eventually for credit for prior learning in some other contexts, perhaps. Those coaches, BHP coaches, which are our interns from our LCC and UO programs, our shorter term alternative school program. This has been really fun. And that's going on right now. So unfortunately, we didn't have anybody from that program. I'm missing class today. But we are in one of our alternative schools at our Bethel School District, and we're going to be in at least 1 to 2 more alternative schools next year. So a little different student population, and we're really enjoying that experience. Rural, very contextualized on site. We're doing a lot of cool capstone projects. Next year, we're going to be part of, with Lane Workforce Partnership, a pre-apprenticeship program. We're going to become the next behavioral health pre-apprenticeship program in the state. And then we're working on a lot of enhanced industry partnerships. So with that in mind, so much talking, so little time. Hi, y'all. Are we ready? How are we feeling? Had enough time to be bored? There we go. Okay. So we won't get into this because I think we're running a little low on time. We are working towards hubs in the county. I'm happy to talk with anyone who wants to talk about that more later so that we can better meet all of the needs of our different areas. But I want to really make sure we hear from students because I think that's what y'all are here for. So I would like to start. Tony, can I put you on the spot? Or should I start with Sophie? Okay, we'll start with Sophie. And then we're going to go all the way down and then back to Tony. I love it. So as a reminder, y'all, name, pronouns if you're comfortable, your year. I know you're all in different kinds of programs, so that's going to be a whole thing, right? But your school would be great. And those of you who have different roles beyond students, coaches, if you wouldn't mind saying that, we'll do that first. Ready?
Hi, everybody. Nice to be here. My name is Sophie Vaughn. I'm a junior at Cresswell High School, and my pronouns are she.
Hi, I'm Kendall. I am a junior at Cresswell High School. My pronouns are also she, her. I'm really excited.
Hi, I'm Aaliyah. I am also a junior at Cresswell High School, and my pronouns are also she, her.
I'm Kelsey. I'm a second-year student at LCC. I'm in the Addiction Studies and Human Services program, and I'm also the BHP coach.
Hi, I'm Ruby Lockemeyer, she, her. I'm also one of the BHP coaches. I am at Lane, second year, and I'm going to be transferring to the Balmer Institute next fall. And I'm also going for my behavioral health certificate.
Hi, everybody. My name is Shaylee Milan, she, her. I'm also at LCC. I'm finishing up my Associates of Applied Science this summer, and I'm also a BHP near peer coach.
My name is Shane Potter. I use he, him pronouns. I am a first-year student at LCC in the Human Services program, and I also work as a BHP coach as well.
Hi, my name is Jordan Saracino. I'm a 12th grader at South. He, him pronouns. Yeah.
I'm Sorrel Randolph. I'm a senior at Churchill High School, and my pronouns are she, her.
Hi everyone, I'm Alexa. I go by she, her. I'm a senior at Churchill High School as well, and I'm part of the speech.
Hi, I'm Tony. I'm sorry, I use they them pronoun. I'm a junior at Mapleton High School.
And we have BHP until we've got fire EMS and then health sciences represented in the house. So, so next up, what I've asked the students to talk about is one, something that they've gotten from their experience that has somehow been impactful for them, okay? And then two, some of the barriers or challenges that they've either already experienced or they anticipate experiencing, in case that might be useful for your strategic planning. So I'm gonna start this one in the middle with our coaches to do a little shot. Does that feel okay? Miel, did you want to say hi too, by the way?
Hi, I'm Miel, my pronouns are she, her. I'm a senior at U of O in the FHS program, and I am also a BHP coach.
Yes. Thank you. Miel does not want to be up here. This is why I'm here, okay? I just want to make sure I represent everyone, all right? Okay, Kelsey or Ruby, would you mind getting us started?
I can go. Okay, yeah. Something that I've noticed when working with the students in our schools, I've been here since August, is just witnessing the connections between students that wouldn't necessarily talk to each other. When they join the classes and the in-person classes, there's been a lot of friendships be made between social groups that I wouldn't have thought would normally talk to each other. And it's been really cool to see that. And then for me, it's given me a lot of experience. I've been able to meet a lot of really cool people. Especially today, I've met a few people and it's been really nice to talk to everybody. I've been able to get a lot of industry recognized credentials and trainings, and that's been really helpful that I probably wouldn't have gotten if I didn't take this position as a coach. It's definitely helped me in my communication, being able to talk to our students and talk to our other coaches and other people in the community has been really helpful. Then I wrote everything down, my brain is gonna forget everything. And just a lot more knowledge on how to better help those in my future work. And then, are we doing challenges and barriers?
Yep, go ahead.
Going into this field from right out of high school, I didn't know what human services was. I didn't know what mental health meant. I didn't know what behavioral health was. Just didn't know. I grew up in like Marcola, Thurston, rural areas. So I just didn't have that much access to the knowledge about these fields. But if I were to have a program like this in high school, it would have really helped just expand everything that there is to know. I think it's really important to know in any field because we're doing a little bit of research with that, getting other fields and how they cope with their things. And then, yeah, just being able to help destigmatize mental health and have a better understanding about the career opportunities that can come into this field.
So, Shaylee and Kelsey, you get to choose what direction we go next.
Oh,
I've learned a lot in the LCC program, specifically more with my peers. A lot of them are like pretty much older than me. There's a lot to hear if you just listen to them, their life stories, their experiences, and then the skills in the classes themselves I've applied to my actual life, which have been really helpful. Yeah, and then also with the students, it's nice to see them interact with people who you would probably not see them interact with, and B, see them be excited and interested in something and pursue something. And then a challenge, I would also have to go with not really knowing that much about human services, mental health. I knew that human services was hard, but I didn't know like how many pathways you can take in the field, like behavioral health, physical health, there's just so many paths you can take within the field. And I feel like that would have been helpful for me in high school, instead of last minute kind of like figuring out what I wanted to do. I feel like if that was taught more for students, that would make them feel more comfortable going into college instead of being surprised when they're already in their program, maybe not like. Something that I've taken away from the behavioral health pathway is, I would say, learning on how to identify what you're feeling and understanding that you're not alone. I feel like in high school, it's really hard to go tell your friend, hey, I'm feeling this certain way. And so having these group of girls, oh, I feel this way also, has just made it so much easier and make me feel like personally that it's okay to feel that way, and help understanding where to go to get these resources, and understand that it's just normal, and I feel like it's just so stigmatized. And so just building the wellness center, just creating a space for high schoolers to go, or anywhere, but just a place, I think is very important, and learning the resources and how to get resources to people is very important. And then a challenge, I would just say, like they said, just not knowing specifically. I've always wanted to be like a therapist, and thinking psychology was the only way, but I got introduced to social work, and then social work there's an LCSW or there's an LPC, and just seeing which pathway and which college I go to and which prereqs I need to go there, and not choosing the wrong one or the right one, you don't know. And so just having more access to those would definitely lessen the stress of picking where you want to go.
And I would love, thank you for kind of setting up. I want to make 2 quick points off of this. One of the conversation points we've talked about a lot, because again, I have so much background in that retention piece for students, is math. I know that sounds like a strange thing for me to be saying in this space, but we had a whole conversation about, do I really need to take calculus? And I was like, how committed are you to social and behavioral sciences? You are. You have stats and you're good. And that has huge implications for their life in high school. And also what their GPA looks like and their financial aid and all that kind of fun stuff. And so, so that seems small, but even those kinds of conversations make a huge difference. And I want to put one more plug out there for the idea that if this program were in a state where we already had an AAOT, Leah could actually be finishing out a 2-year degree next year, and by age 21 could be finishing out a graduate degree, because she is headed potentially towards social work. And so I just want to put another plug in there for how important it is to be thinking about that, because these are all students who I know could be doing that right now if we had that. So.
So something that I've taken away from this program is just the overall direction that I want to go with my future. It's guided me a lot, just with like just before Casey introduced me to this whole thing and I got thrown into it. I was totally blindsided, and it felt really vulnerable to just have kind of the direction I wanted to go, but not have any resources available to me to help me kind of get there. Already I have so many experiences under my belt just through this program that I know for sure that I wouldn't have gotten. Yeah, it's the case to that. I'm very thankful because I just feel so much more prepared. Something that I kind of touched on it, just the fact that there are so many people right now in my school just alone that I know are so interested and would really benefit from something like this, and which it just makes me think that at other schools who don't have this opportunity, what are they like? They don't have kind of the option that I have. I know I'm really grateful for that, because now I kind of have more of an idea, and a great resource, Casey. She's very helpful with career informative stuff. So just that's something.
One of the biggest positive impacts that I've seen personally from the behavioral health pathway is the amount of applicable information I've gotten from it. We all have our own experiences with behavioral health and the behavioral health of those around us. And a lot of the education that we get in high school often spurs the question, when will I actually use this? But behavioral health is definitely something where I've learned a lot about both myself and others. And then not only is it something useful in everyday life if I decide I want to go to a different career, it's also something that can help boost me towards a career. And I've gotten to do trainings like question persuasive prayer and sources of strength and CPR and first aid that are really helpful in learning about like just getting the things that will help me propel my career. But one of the biggest challenges with this has honestly just been some of the confusion. I'm from a very small town, rural. There's not a lot of things going on in Crestwell. It's quite small. And one of the biggest ways that we understand what is out there is by what we see around us. But in my town, there are no behavioral health resources. If I walk through Crestwell, I can't find any therapy offices. I don't know where to go for behavioral health. And so it's hard to see the different career pathways when I don't see them around me. But through this, I've been able to understand that there are a lot of different things that are available. Especially with the advent of new technology, there are a lot of things like the Whitebird Who's Clinic where you can go online and you can get therapy services. And so they're making it accessible to rural communities, but being in a rural community is hard because I don't see that. So it contributes to the confusion, especially with this small amount of resources that we have in such a small school. Crestwell does a very good job of making resources available, but there's only so much you can do when we have less than 400 kids in one school. And there's only a smaller amount of people that want to be into that. So having somebody to come in and help us is really helpful, but it's still a confusing.
I wrote some of it down. A major part of my growth has come from like connecting with mental safety or the peers she brings in from like during Fridays to bring in like class sessions and to deepen my interest in like neuroscience and cognitive behavior that I've been learning. These conversations have helped me like learn how the body and mind works beyond the classroom. Learning about social determinants of health is really incredibly impactful because it plays in how environments where they live, where they work, and how they shape their health and opportunities with one another. And I think about this well-being every day because it affects me and everyone else around me. Growing up and going to school in a rural community came with a lot of challenges because, as Casey said, this is a program where they come to you and you don't come to them. So it means like limited resources, especially in a rural community where it means fewer opportunities to touch on the subject more deeply and in depth. And this class helps understand how to reduce the stigma within rural communities that don't always have access to these and where it isn't talked about all the time. And that's why this program has been really meaningful. Even though people who, like I said, do not pursue a mental health career, they can really gain a lot of expertise and from just the broader and like aspects within this program.
Alexa, would you mind jumping in?
Yeah. Something amazing for honestly just BS. Honestly, it's been great. That we learn every day. We go from fungal infections, bacterial infections to laws and ethics. So many units that we cover, and I think that has helped me personally because I initially thought I wanted to go with peds. With further research, I was like, I want to work with patients of all ages. I don't know if I want to do children or adults. So I was like, let me do them all. And so family medicine is where I'm headed now. But I think having that background and then all these like choices and options, like there's so much out there, and so being able to learn that in the classroom every day kind of guides you now instead of going in undergrad and figuring out there when you're already spending money. You're already kind of stuff with having that now has been something really impactful for me. I'm sorry for all of those who have not had that support when we were this young. That's just honestly been what's great about CHSP. It's just so much that we learn every day in the class. The challenge I would say, kind of emphasizing what some people said is, I think the lack of opportunities to kind of gain these entry level experiences. I would say that without CHSP, I would not have all these experiences that I do have now. Volunteering at clinic, doing med splash. I think a lot of things require like certifications and you have to be this stage. But there are skills that I haven't know that we as a class have that we could apply those into professional spaces and I think the opportunity could not only benefit us, but also the professionals kind of see like, these students are really serious about this and it's amazing that they're so interested. So I think the benefits both ways and at least the opportunity was there. But I think that if it wasn't there, I guess you didn't really know. And also just as a student, you kind of don't have that sensation to want to keep pursuing a career. Yeah, I think professionals do like a really good job at coming and saying, this is what we have, but maybe in a couple of years when we whistle or when we have the certification, just I feel like entry level opportunities would be incredible for both parties.
Joining the program halfway through my junior year, I had transferred from Springfield. Like touching back to what Alexa said, like the skills we learn, like medical terminology, charting. There's a lot of things we learn, like infection control, like all the different body systems, and we also touched into like HIPAA. So like learning some of those skills just half my junior year and just retaining all that detail and knowledge, because at Churchill we really got into detail, she broke it down to where you can actually understand how things work or like what causes what. So just having that knowledge for like a couple months, I had a job shadow, not a job shadow, I had an internship at G Street Integrated Health, and I was shadowing like MAs, like nurse practitioners. So when I was and it was family medicine and urgent care, so I was in between. I knew like the situations and what was going on. Like they would let me, like by my second week, I was rooming patients by myself, reading off medications, checking like their history, medication history, and just asking, okay, like what exactly are you here for? Like by my second week, I was also doing vitals because we did learn blood pressure, like pulse, all your basic temperature, heart rate. I learned all of those just in like a couple months and was able to do that by myself my second week in a real facility healthcare. So that's just my junior year. So now going into my senior year, we touched into like we're able to get certified, CPR certified, and BLS certified. So having those certifications was really helpful to get a caregiving job, which I'm going to touch right back into, but just having those certifications was easy to help. And then we're learning more into like actual careers. Like we had an EMT unit and learning, and we had bleeding control unit where we learned how to like stop gunshot wounds, any bleeding and severe bleeding like that. So, and it's just a lot of hands-on skills we've had. Like it depends whatever unit we actually would always have like certain skills that we have to test on, like CNA skills, like patient transfers. We would do those types of skills. So I think just having all that being taught just in high school has really prepared me. I feel very prepared for college, and so that has really helped actually a lot. But the disadvantages, having all that knowledge and that experience already, it helps a lot, but what limits me is like age. Like you can't do anything. Like even though I'm already prepared, I feel like I can go be a CNA, I can go do a caregiving. I feel like I can do a medical assistant with a little bit more training just because of how much like I've been taught in my high school classroom by Miss P. Like it's been so helpful. So just having all that, like it just makes me very confident within myself. So just having that age limit, it really doesn't help, because I had to wait until February of this year to turn 18, and I applied to a caregiving job and I got it immediately. I had my orientation. All the stuff in orientation I already knew or was comfortable with because I had already learned it in my classroom. Patient transfer, reading medications, like checking medications, like the 5 rights, like we've gone into a lot of detail, so I just am very prepared for that job. And during the orientation, I was already comfortable. I was helping other people who didn't have any knowledge at all. They were twice my age. Like, it really helped a lot. So it's that, I feel like it's just one of the biggest barriers is just the age limit, because like you can get certain certifications and caregiving prepares you a lot and with the caregiving facility I work at, they provide a CNA scholarship. They'll pay for you to get your CNA. They also have another scholarship where they'll pay for educational courses to help with classes, certifications, stuff like that attached to a career that you want to do. Like, they have that, but the barrier is age. So I feel like just that being adjusted, there's a lot of people, especially in all these different pathways, that could be like such a big asset in the healthcare world out there. And just at 16 years old, like they really could, because we're being that much prepared inside the classroom.
Alright, so what I found like best is the connections I made between my teachers and like the real world. So they're all firefighters, EMTs, all that. And they can like give you a certain pathway that you want to go down. Like, I'm looking to be an EMT. And they can give you that, but they can also give you another option to try at the same time, which just opens your mind and opens what you like originally wanted to do, and makes you try a new thing, which creates a great strategy for the rest of your life, pretty much. And they also give you like the right materials to finish the job that you're trying to do. So I'm doing the EMT class right now, and doing all of that plus the EMR that I'm also doing. They've like combined it into one thing and just heightened my ability to do both at the same time. And that's led me into like being able to do another like firefighting job this summer, and they all have just like collected into one thing that has grown to be pretty much what I want to do for the rest of my life. Yeah, so that's the good part about CT so far. One of the struggles is some of the time, like certain parts of the day, it's hard to do the CT, like the EMR and the firefighting, and I feel like I don't get enough time to do that, and it'd be really nice to get more time to do that. That's pretty much it. So.
And I so love that you said that, because if there's a complaint we have, it's that we don't get enough time for students. Tony is coming in on Friday when they don't have school to do this. Crestwell students, we have a half an hour every week to come in and do as much as we write. And they also have to take online coursework, right? And then come in extra days to do their skill days, right? And we have similar things, right? And so that's part of why we're trying to work towards kind of this regional hub model, so we can start getting some things going in different areas in the county. But it's tough. It's just, so that's a very real, and I'm so glad you all are sharing fabulous things. Yeah, you.
And would that be alleviated by the, I'm sorry, the acronym, I'm gonna get it wrong, that is used, the model used in other states that helps accumulate more hours?
Yeah, if we had an early college program where we could really make this a huge focus. Because some of what we've been able to do with our Hope Factory, which is our construction oriented, I helped with building out the ELA curriculum. We could be doing so much embedded and co-curricular, and like all this cool stuff, right. But, you know, we don't have that here. And then Lane County is not a great candidate for a CTEC Salem Kaiser model. We've had a great feasibility study done about whether or not we could try to have it as sort of central location for Lane County, and it's just not a good fit. So we're doing our best, right, to kind of keep iterating with all of our different health sciences experiences. But in addition to all the other challenges right now, like the fact that we've got, you know, huge budgetary cuts that mean our CTE programs are usually the first, CTE programs and counselors are some of the first folks who are leaving right now. And so we're trying to figure out how we do that. So I want to make sure, Shane and Shaylin, would you mind jumping in?
What's been most valuable to me through the human services program has been acquiring the skills that have been that prepare me to join the Oregon behavioral health workforce at a time when we've been talking about the demand continues to grow. Through the program, I've learned better communication skills and recognizing issues that are going on in students' lives and being able to better assist them at a very critical time in their life. And also to be able to have hands-on work to be able to really help them see beyond some of the glass ceilings that they have in their life, and presenting just more options and more information to students has been really valuable. One of the things that really stands out to me has been mentioned several times in this panel already is people telling me that I wish I had this when I was in school. I find that it would have been incredibly important in my life, but hearing that from other people when we're describing our work or we're working with students reassures me that this is something really powerful and it's really important, and that helps really put the wind back in my sails to continue on with my education and continue on working, because you really see the value of it in a day-to-day practice. One of the biggest challenges for me has been financial strain in my life. As being a student and working in kind of an entry-level position, between books and life and costs and everything, it just really stacks up, and having a job that I find so much value in and love so much, but a lower paying position in these entry-level positions, it does make a little bit of extra stress in my life, and it really makes me have to choose where I'm splitting time between my studies and my work life, and having a little more freedom there would be really beneficial for me.
And Shaylee, I think you're going to be taking us home because we're getting close to the end of our time, which means there's some other ambitious for those of you who are my community partners who came out. I'm so sorry, but we have several fabulous community partners and teachers and faculty who are also here. So, Shaylee.
I would say, I mean, there's so many things that I love about this program. I love working here. I love all the people I've met. I've made so many connections already. I've been here since October, and just meeting people. I mean, I've met people out in the community. I've met ESD staff, and I know a lot of the students in the program who I've been able to work with have also made some great connections. We've had students who are interning at Ophelia's place. We've had a lot of students get to go out and do hands-on experiences beyond what we come in and teach them. So that's been really cool to see. Personally, I'm going into healthcare following this, and one thing that I really appreciate is just taking so much, both from my LCC classes and from this program, around like trauma-informed language, and just being so aware of kind of mental health and what that means in a healthcare setting. I think not all medical professionals kind of get that context as they're providing patient care. So that's definitely something that I've been thinking about. Also, I got my CPR certification through this program, and so lots of trainings and really, really helpful just resume builders and good hands-on experience, in addition to working with all of these students. So yeah, that's been amazing. I will say, as far as challenges go, this program is like ever evolving, and there's always something that we're kind of tweaking or adjusting or looking ahead towards the future. So it's given me, and I think all the staff involved, some great flexibility practice. But I think it's been really useful, and I'm really excited to just kind of see what the future holds for this program, because we are working really hard to kind of adjust accordingly to what student needs are, and just make sure everything's running smoothly. I agree with what a lot of you have said. I really wish I had this when I was in high school. Like 4 years ago, if I had been able to do what you're doing, I'm going to be a medical assistant, which is what you brought up. Like, you are already, I guarantee you, leaps and bounds ahead of where I was starting my medical assisting program that I'll be done with in 3 months. You probably know more than I ever did going in, and even than I do now, maybe. So if I had been able to do what you've been able to do, that I would be leaps and bounds ahead. So yeah, I would love to see this in more schools.
We could go on and on. These students have shared all the things that are already in all the reports that you have written, right? Licensure, confusion about the fact that next steps are not clear, right? We've had so many great, we've had so much support from our community and from all of the different organizations we've worked with, the schools, all up and down, right? We love that, but so much hope. Thank you all so much for sharing out with us today.
And next steps, I'll briefly, we typically spend a little bit, 5 minutes, 10 minutes on the next step slide, but in reality, so I want to say thank you a little bit longer here. I know we're at a time, however, so our next steps are, the next meeting will be, we are in the working details right now, so we'll be announced shortly. And really the next step, I'll just sum all this up, is that we are working in the strategic plan and we're taking action on the strategic plan. And today's strategic plan discussion is really going to be highly informed by also what we've heard today from you all. And we're bringing it back to the state level. So what it means is that all of you 11 today here, and I know there are so many more, it's just what we had to, probably more students were able to be able to come. But hearing, for example, I've noticed the audience, everybody was nodding and smiling, and kind of after so many hours of this meeting, legged up, hearing that in your second week, you were already alone and practicing and you're not scared, you're advocating for more hours and to keep going, knowing what you're signing up for, you have a burnout, not enough money, but you are so committed to helping community, that motivates us. And everybody who's listening today, there will be recordings shared at the state level. So a lot of people will hear you. Probably today, you convinced some younger folks to join the profession. I heard you today and I thought, if I heard you earlier, I wouldn't be here. But thankfully, I can hear you today and we all can. And this is not going to be unnoticed. I know you do so much more. This is not enough time, not even close enough time. We're going to spend the whole day on only you and sharing with what you do. So folks will be connecting, Casey, with you afterwards and asking probably more questions and maybe some more information. So thank you everybody for participating today, for the folks online and all of you. Thank you. That makes our work very different and real. Thank you. Thank you.